one come back to the board. And
well, good morning, everyone, and welcome to Coconino County Board of Supervisors meeting this Tuesday, May 5th of 2020. This is a regular session of the Coconino County Board of Supervisors and the boards of directors of the Coconino County Board of Deposits and the Coconino County Jail District. We have, first and foremost, I want to just make sure that we acknowledge the members of the Board of Supervisors who are on the video meeting so that we know that everybody is here and that we do have a quorum. So Liz Archuleta, Chair of the Board of Supervisors, and Vice Chair Fowler, would you just like to say hello so we know that you're present? Okay, I'm sure she'll be joining us shortly. Supervisor Babbitt.
I am present. Thank you, Madam Chair.
Super. Supervisor Ryan.
I'm here, Liz.
Thank you. Good morning.
Good morning.
Supervisor Parks.
Present, Madam Chair.
Okay, great. Well, thank you so much. And then, of course, we have members of the county manager's office. And of course, we have county team members that are on the line. And so thank you very much for being here. We have members of the public who are joining us via this Zoom meeting. Eric, I'm going to go ahead and turn it over to you to just let members of the public know how they can comment using the Zoom function. Would you like to go ahead and speak to that?
Certainly. Thank you, Madam Chair. I apologize for the silhouette, a little bit sunny in the room here. But for those who are on Zoom, this is a webinar. And so we have identified panelists that we know are going to speak. But if you wish to speak today during the public comment or any portion of the meeting, it is quite simply just pull your cursor down to the bottom of the screen, and there are two options. One is a raise your hand, and I will get a signal that you'd like to talk. As the chair calls for any public comment or questions, we can elevate you to allow you to speak to the Board of Supervisors. Or there is a Q&A function on the bottom of your screen. If you want to type a question or a comment in there, at the appropriate time on the agenda item, we will bring that question to the board and the board can address it. Supervisor Archuleta, as the chair, can see all those functions as well. So we will be able to interact with you if you use that function. And on the phone, again, just simply unmute, and I believe it's *6 on Zoom as well. Should let you unmute and then raise your hand to be called on if you want to make a question or answer. We also do have, just briefly, the email boardcomments@coconino.az.gov, which you can also email any comments or questions to, and we will moderate them and present them to the board for you. Madam Chairwoman, that's my update for that item.
Okay, thank you very much. And we'll remind you periodically throughout the meeting in case you forget how to do that. So why don't we go ahead, and I've called the meeting to order. Would you please stand, those who can, for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. This is now an opportunity for us to have a call to the public. This is a call to the public, basically is an opportunity for any member of the public to speak to the Board of Supervisors about an item that is not on our agenda. Each member of the public has approximately 5 minutes to be able to do that. And please know we won't be able to engage in a robust discussion about the item because it's not on our agenda, but we would be happy to listen to what you have to say and take it under advisement. So I understand that we have two people that would like to speak. Scott Garlick, Executive Director of the Arizona Wildlife Federation, and then also Nikki Julian, Outreach Director for the Arizona Wildlife Federation. And we will call on those two individuals first and then see if there are other members of the public that would like to go after. Scott and Nikki, are you on the line?
Yes, I'm here. Can you
Great.
hear me? Great. So thank you, Madam Chair, members of the Board of Supervisors. I'm Scott Garlett. I'm the Executive Director of the Arizona Wildlife Federation. And I'm here today actually to give an award to Chairwoman Archuleta for her leadership in conservation. The Arizona Wildlife Federation is Arizona's oldest conservation organization. We've been around since 1923, if you can believe that. We are also the state affiliate of the National Wildlife Federation. And we strive to educate and inspire people about the great outdoors, whether it's hunting, fishing, camping, hiking, wildlife watching, whatever it is. And every year, the National Wildlife Federation sponsors a Women in Conservation Leadership Award. And so we had nominated Chairwoman Archuleta for that, for her outstanding leadership there. And I don't know, Nikki, or if Lindsay Daly is on the line, if either of you could share a photo, is that possible on Zoom? Looks like Eric is maybe trying to do that. Anyways,
Yes.
Shortly, hopefully that'll come up. It's a nice glass globe, which we thought was appropriate since we do care about the globe and everything that happens there.
Oh,
Okay,
my
Nikki's sharing
goodness.
it.
It's really stunning. Yeah.
That is so beautiful. Thank
Yeah,
you.
so we will get that to you at some point. I'm sorry we can't give it to you here in person. But again, I think the supervisors probably are very aware, but you guys have been facing some challenges there with forest fires and flooding after that. Some of those because of a hotter, drier climate. We recognize the work that Liz Archuleta has done in the community for those types of things. Also, you face the challenges with uranium mining at the Grand Canyon. That's something that Arizona Wildlife Federation has been fighting against for a long time. And As Art and Liz and others probably know, we are not anti-mining. We're not even anti-uranium mining, but when it comes to the Grand Canyon, we think that's not a very good place to do it. And Liz has also, she is one of the founders of the Hispanics Enjoying Camping, Hunting, and the Outdoors, or ECHO, which we think is a fantastic program to get people to get outside, to recognize the value of all the great places we've got in Arizona. So Liz, thank you very, very much for all the great things you do with respect to conservation. And we look forward to a long-lasting partnership with the Arizona Wildlife Federation. And I might also add, there's several others on this esteemed board of supervisors that do great things as well. And thanks to each of you.
Well, thank you so much, Scott. Thank you, Nikki, and thank you to the Arizona Wildlife Federation. I mean, you're an incredible organization with a long history in Arizona, also nationally, the National Wildlife Federation, and globally. And so we really appreciate your leadership, Scott, and Nikki, for what you do through your outreach. It's really my honor to be able to accept this award. It's very, very meaningful to me. You know, as a fourth generation resident of Arizona, my son being the fifth, we have deep roots in Arizona, and you know, some of my fondest memories are that of my dad and family, our family going out and, you know, cutting wood to heat our home with fire, or going to pick, you know, piñones off of trees, and just going into the forest. And remember my dad saying, you know, when you only take what you need and from the forest in terms of wood, and you make sure that you leave no trace of you being there, that you respect the forest and our public lands and be stewards of it. And so I've had a long time familial and cultural connection to the land, and certainly as part of my being, and something that I want to, you know, pass on to my son and to generations beyond, just respecting the wildlife, respecting our public lands, and being stewards of our lands. And really want to appreciate my colleagues on the Board of Supervisors for their support of my work and of Coconino County's work in this space. Public lands are very important to us, and all of us have been very vocal around the protection of public lands. And so we appreciate your partnership, Scott and Nikki, and the partnership with the Arizona Wildlife Federation. I certainly appreciate the work that ECHO's doing along with the Wildlife Federation. They do some incredible work of elevating and amplifying Latino voices, Hispanic voices, in regards to public lands and to clean air and clean water. And so it's a valued group that I know that you work closely with, and that I work closely with, and really appreciate being able to operate in that space.
Well, thanks again, Liz, and thanks to the entire Board of Supervisors in Coconino County.
Great. Well, thank you very much, Scott, and Nikki and Scott. Have a great day, and thank you for this really incredible honor. I will definitely display the award with pride in my office, and it will be a constant reminder of the importance of our partnership.
You're welcome.
Right. Thank you. Is there any other member of the public who would like to speak to the Board of Supervisors at this time? Okay, hearing none, then we'll go ahead and go on to our consent agenda. And the first item on our, well, actually prior to our consent agenda is a proclamation. This is consideration and possible action to approve a proclamation designating May 2020 as Mental Health Month. And I'm going to turn it over to our county manager, who perhaps would like to introduce this item. And then I know Erica Shaw and Ella Ness are going to be presenting this. And I'll turn it over to Jimmy first, and he can introduce both Erica and Ella. Jimmy?
Yeah, thank you, Madam Chair. So if there's always a time where we are being mindful of our mental health. And if there's ever a time where that is even more important, is right now, as folks are going through an incredibly stressful time and many people are having many challenges beyond normal life challenges. So I just want to start by, Madam Chair, members of the board, just recognizing the work of Erica Shaw. I was listening to NPR yesterday morning, and Erica, I heard the Stronger as One advertisement yesterday morning, and I just want to say thank you for everything you're doing in the Stronger as One space, but also you have been an integral part of our Emergency Operations Center response in Health and Human Services. And I just, Erica, say thank you for who you are, and glad you are part of our team. So, Madam Chair, if I can, I'll turn it to Erica, and then she can introduce the item. I think she plans on reading the proclamation and all of the others that are on the phone. So, Erica?
Thank you so much, County Manager Jane and Madam Chair, members of the board. I truly appreciate your recognition of the importance of mental health and well-being. It's your ongoing support of this initiative and promoting and making sure that people are aware of the critical nature of taking care of yourself and of others that has helped Stronger as One succeed. So thank you so much for considering this proclamation today. And for continuing to be advocates of mental health and well-being in our county and our region. So unfortunately, our student who was planning to read the proclamation today was unable to make it, but I would like to introduce Julia Diaz, who is our Stronger as One youth specialist. Julia runs our Stronger as One teen club, who Ellen Ness is a member of that teen club. And Julia also oversees the teen and young adult initiative for Stronger as One. So today, Julia is going to read the proclamation recognizing May as Mental Health Month for us.
Hello, this is Julia Diaz. So for the proclamation designating May 2020 as Mental Health Month, whereas our country observes National Mental Health Month during the month of May to increase awareness about mental health, this observance is a pledge to build a culture of knowledge, compassion, and action for mental health, to raise awareness that mental health is a vital component of overall health, and that mental health illnesses are common and treatable, and that recovery is possible. And whereas our community and our world at large have faced unprecedented disruption, fear, and loss during the outbreak of COVID-19, impacting our collective well-being and making existing mental health challenges considerably more difficult to manage, we recognize the importance of supporting one another now and as we move forward. Whereas Stronger as One and Coconino County have developed free, digitally accessible resources to support individuals and families as they cope with the upheaval and uncertainty of necessary physical distancing measures, to support the development of positive coping skills and connect individuals to critical resources. Whereas the county commits to engaging teens, young adults, and community members in designating and designing and developing community-based solutions that will improve mental health and well-being in partnership with the Stronger as One and our dedicated community members. Whereas death by suicide affects individuals, families, and the entire Coconino County community. The rate of death by suicide in Arizona has been higher than the national rate since 2012, and the rate of death by suicide in Coconino County has been higher than both the Arizona average and the national average since 2016. Whereas Coconino County has many partners engaged in grassroots efforts to address mental health and suicide prevention in our communities, which are solidified by regional membership in the Stronger as One coalition. Whereas Stronger as One and regional partners remain committed to providing free mental health first aid training and developing innovative opportunities for connection and support as we prepare for the future, however uncertain that seems right now. Whereas sharing personal experiences of living with mental illness or the loss of a loved one to death by suicide can reduce barriers and normalize the process of individuals seeking mental health treatment to live a long, healthier life in our communities. And now, therefore, we do hereby proclaim May 2020 as Mental Health Month, pledging to develop and implement a strategy to train all county staff in mental health first aid.
Thank you, Julia. We definitely appreciate you reading the proclamation. I'll go ahead and ask for a motion and a second, and then we can have some discussion. Is there a motion to approve this proclamation?
So moved, Matt Ryan.
Is there a second?
Second, Lena Fowler.
Thank you, Vice Chair Feller. There's a motion and a second. All in favor, please say aye.
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 Any opposed? Okay, passes unanimously. Thank you. And any discussion from members of the board who would like to speak to this item regarding the proclamation designating May 2020 as Mental Health Month? And you just need to unmute.
Madam Chair.
Yes, Vice Chair Feller, go ahead.
Yes, I think this is so important. Thank you. Thank you for bringing it forward, this proclamation, or it is just these times that we're going through right now it's just so important for each of us, everyone, to take care of ourselves. When you are just on the run, first line personnel, and even if you're not out there working, people that are that you lose in the community, it really does affect you. Whether you know it or not, it's somehow in your body, in your mind, it is bothering you. And for that reason, everyone needs to take notice of themselves mentally and physically, and do some, relieve some stress in your own way. And I just think that this is something that's so important with this trauma that we're going through. I think it's going to be here for a long time. It is, we keep talking about unemployment, businesses. We keep talking about how people are impacted in the communities, and this mental health is at the core of all of that right now. So I just want to thank you for bringing it forward, and let's all recognize that this is going to be here, and that we need to work towards making sure that our staff and families are well. So anyway, just want to say that. Thank you.
Liz, if I may.
Yes, please go ahead, Supervisor Ryan.
Thank you, Madam Chair. So in following Lena's comments, I would agree. This is unique to everybody. There are really challenging times, as Jimmy had noted, and it's going to be prolonged. And so the impacts are yet to occur. In the meantime, beyond that, it's so different because for those that are impacted directly and have lost family members, it's a silent process because we're all social distancing. So again, there is a different dynamic that it's really important that we have resources out there. So appreciate you bringing this to the attention of the community and being there, Erica. And it's important that we just we let people know that there are some resources out there that they can go to and they can call. And the only other thing, just quickly, is I doubt somebody has it on their fingertips right now, but you know, I've been hearing a lot from other jurisdictions of they're seeing an uptake related to this, and I'd be curious to see what our numbers are in our own county. I don't need them right now, but I would like to see what they are. Thank you, Madam Chair.
Thank you, Supervisor Ryan. Any other member of the board? Okay, well, great. Well, all of us as a board echo the comments that were made by Vice Chair Fowler and Supervisor Ryan. And again, we all echo the thanks to you, Erica, and thank you, Julia, for your work. We definitely appreciate it. I know that we have one member of the public, Carrie Bloom, that wanted to speak to this item. And so Carrie, please go ahead and make a comment now.
Thank you, Chairwoman Archuleta. My name is Carrie Bloom, and I am a consultant with the NARBA Institute. Had the privilege of working with Stronger as One for the last couple of years. I was reminded last night of a year ago when the board adopted this resolution for Mental Health Awareness Month. And I thought, little did we know then what we were preparing for. The county at that time, with the leadership of Chairman Art Babbitt, took a very bold stand and made a commitment to Stronger as One early on. I want to thank Dr. Marie Peoples for her leadership in building this coalition of Stronger as One, and the many community partners who assisted, the NARBA Institute, and the law enforcement, the educational systems, the FUSD, the community college, the NAU, many partners all came in and built up a reservoir really of resources, relationships, and awareness of the need to support mental health and well-being. Fortunately, because we were able to bring on Erica Shaw, we were able then to respond very quickly and to adapt to the needs that the COVID crisis has presented to our community. The website and the resources that Erica and Julia put together are now a very valuable source for our community. I want to urge everyone to take a look at that. It's on the county website under Stronger as One. So I know we're facing really difficult times, as Supervisor Fowler mentioned and others, but we do have resources and we do have ways of staying connected. So it's painful. These are difficult times, but please reach out. There are many resources. And thank you to the county board, to Manager Jane. You all have been the backbone. You are making it possible for Stronger as One to thrive. And we deeply appreciate that.
Thank you very much, Carrie. We appreciate the partnership that we have with all of those that you mentioned. And thank you for giving us a look back on history, and really it is something to celebrate.
Thank you.
Any other members of the public that would like to speak to this item? Okay, well, we have a motion and a second, and so all in favor of the motion, please say aye.
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 Any opposed? Hearing none opposed, passes unanimously. Thank you. Now we'll go to the Board of Supervisors consent agenda. This is a consent agenda that has several items on it because we've either had a presentation on these items before or they are administrative in nature. Is there any member of the board that would like to remove an item from the consent agenda, items 1 through 7? Hearing none, is there a motion to approve the consent agenda of the Board of Supervisors?
So moved, Supervisor Babbitt.
Second, Supervisor Fowler.
Thank you. There's a motion and a second. All in favor, please say aye.
Aye.
Aye. Any opposed? Say nay. Hearing none opposed, passes unanimously. We now need a motion to resolve as the Board of Deposits. Is there a motion to do so?
So moved.
Second, Matt Ryan.
Okay. We have a motion by Supervisor Parks, second by Supervisor Ryan. All in favor of the motion, please say aye.
Aye.
Any opposed, please say nay. Hearing none opposed, motion passes unanimously. We now need to resolve as the Board of Deposits. Is there a motion to do so?
So moved, Supervisor Babbitt.
Second,
Supervisor Parks.
All in favor of the motion, please say aye.
Aye.
Any opposed? Okay, passes unanimously. We are now the Board of Deposits. This is a consent agenda item. Is there anybody who wishes to have a presentation? And if not, then I'd be prepared to accept a motion on the approval of a bank services agreement, 2-year extension with JP Morgan Chase Bank as the Board of Deposits in accordance with ARS 35-325. This is coming out of the Treasurer's Office, and we do have Treasurer Benatar, who is here to answer any questions if we have questions. Are there questions at this time? Okay, hearing no questions, is there a motion to approve this item?
Move to approve item 8 as presented by the chair.
Second the motion.
Okay, it's a motion
Aye.
by Director Babbitt, seconded by Director Ryan. All in favor of the motion, please say aye.
Aye.
Any
Aye.
opposed? Please say nay. Hearing none opposed, passes unanimously. And Treasurer Benatar, was there anything you wanted to say about this? I know you were just here for questions, but I didn't want to overlook if there was something you wanted to add.
Thank you, Chairwoman Archuleta. No, at this time, I just want to thank you. This will be a 2-year extension from the initial contract that we started about 3 years ago. So per statute, we can extend past 5 years. So this would allow us not to go out to bid until another 2 years from now. And then I just want to let everyone know that in terms of fees for the bank, it does not come out of the treasurer's budget. It actually comes from interest earnings. So fiscally, this is a really sound decision, and it won't impact our budget in any way. And again, thank you for the approval of this.
Okay, well, thank you very much. Is there a motion to resolve as the Board of Supervisors?
So moved, Director Babbitt.
Is there a
Second.
second?
And Supervisor Parks, or Director Parks.
Excellent. Okay, there's a motion, a second. All in favor, please say aye.
Aye.
Any opposed, please say nay. Okay, passes unanimously. We now need to resolve as the Jail District Board of Directors. Is there a motion to do so?
Oops.
So moved.
Okay, moved by
Supervisor Parks.
Supervisor Parks. Is there a second?
Second.
Second by Vice Chair Fowler. All in favor of the motion, please say aye.
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 Any opposed, please say nay. Okay, passes unanimously. We are now acting as the Jail District Board of Directors. We have 3 items on the consent agenda. Is there any member of the Board of Directors that wishes to separate one of these items out? Okay, hearing none, is there a motion to approve the Jail District consent agenda?
So moved, Director Babbitt.
Second, Director Parks.
Thank you. There's a motion and a second. All in favor of the motion, please say aye.
Aye.
Aye. Any
Aye.
opposed, please say nay. Hearing none opposed, passes unanimously. Thank you. Is there a motion to resolve as the Board of Supervisors?
So moved, Director
Parks.
Babbitt.
Director Babbitt moves. Is there a second by Director Parks, I heard?
Second.
All in favor of the motion, please say aye.
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 Any opposed, please say nay. Hearing none opposed, passes unanimously. That leads us now as the Board of Supervisors to item number 12, which this is an update, discussion, and possible action regarding the coronavirus COVID-19, including but not limited to the possible issuance of a proclamation restricting the use of certain public establishments. And I'm going to turn it over to our county manager, who will then pass it to Dr. Marie Peoples. Jimmy?
Yeah, again, good morning, Madam Chair and members of the board. You know, in a public policy arena today, you know, we are very concerned about the public health of our residents and also of the team members that we have in our organization. The board took a bold step back in mid-March with the original proclamation that did expire on April 1st. was not reissued with the governor's executive order. But now, with some uncertainty moving forward, we believe, as the board and the organization believe, that it is important for us to continue to make a strong public statement in support of the protection of public health using science and data in helping to inform decisions not only of our organization, but the residents that rely on us to provide public health expertise. So, Madam Chair, the proclamation is in front of you, and I want to say thank you to Joanne Keene and the team for helping to put this together, Rose Winkler. And now Marie is going to speak to this proclamation, and Joanne also stands ready to answer any questions that you may have regarding item 12. So, Madam Chair, Dr. Peoples.
All right, thank you very much, Jimmy. And Dr. Peoples, thank you very much for being here today and providing us with an overview.
Hi, good morning. Thank you so much, Madam Chair, members of the board, County Manager Jane. Really appreciate the opportunity to provide the COVID update and to share what has been occurring in the Emergency Operations Center. We also have Dr. John Mugen from Northern Arizona Healthcare that's going to join us. So Madam Chair, if I can, and he just joined, I see he's on. If it's okay, I'd like to go ahead and give an overview of the isolation and quarantine hotel operations, and then allow Dr. Mugen an opportunity to share as well.
Thank you very much. That would be great, and welcome, Dr. Mugen. So we're going to go ahead and go with that item first.
Great, thank you. So as the board knows, but for the individuals that are also calling in and joining the board meeting today, the Aspen Hotel was set up as an isolation and quarantine operation, and it was stood up very quickly at the beginning of the COVID-19 response. The primary objective of the quarantine and isolation operations were to stop the transmission of COVID-19 in congregate settings, particularly within our homeless shelters across the county. There were 3 primary populations that we've been approved to serve, and that approval comes from FEMA. And so that is COVID positive homeless individuals and those awaiting COVID-19 test results, homeless individuals who are 65 years or older and at elevated risk for COVID-19, and first responders and healthcare workers who need sheltering options. And so we're really proud of those operations and that we were able to respond so quickly. However, it has come, sorry about that. However, it has come at quite a cost. The total operational cost so far is $630,846. And to date, we have housed a total of 84 people, which we do believe, and according to our epidemiology reports that we had from our Northern Arizona University partners, and just as we're really keeping track of our cases, we do believe it has assisted in flattening the curve and slowing the spread across Coconino County. Currently, there are 19 guests there. But what is ahead of us today is talking about how we continue supporting isolation and quarantine hotel operations, and if that is something that we continue. So again, the cost has been $630,000 and change. And we have researched additional options and perhaps some additional cost. I'll share those a little bit later and go ahead and open it up to Dr. Mugen at this point in time. Dr. Mugen, thank you for joining us.
Yeah, thank you for inviting me. And I want to start off by thanking the county for their rapid action in standing up this facility. Early on, we were struggling with emergency room patients that were homeless. We didn't want to send them back to the shelter, and we saw that this problem was going to just grow over time. And so really appreciate the fast action, and I think it has benefited both our sheltered population by having somewhere to put these patients while we were waiting for the tests. One of the other things that challenged us at the beginning is the tests were taking a lot longer to come back, sometimes 5 to 7 days. And certainly for our less ill patients, it wasn't reasonable to admit these patients while waiting for that length of time for tests. So it provided us with an excellent option as far as housing these patients until their tests come back, and allowing them to rest in an area that was more comfortable for them and safer for others. So really appreciate that. We do feel like the Aspen Hotel does provide value, but I am aware of the very high cost. So One of the things we've been looking at with representatives from the county as well as sheltered services is there another less costly alternative? Because we still think that there is a need for an option for these patients that get tested while we're awaiting testing. One of the lights at the end of the tunnel is the ability to perform rapid testing or what they call point of care testing. It's the testing we have is not truly point of care. It takes about an hour to come back, but could be performed while the patient is waiting if we don't have an alternative. But right now, the limitation with that is having enough test kits to provide those for all the different types of patients that need this type of testing. So I think the appeal from NEH is if Aspen Hotel is no longer going to be available, what might be an alternative? Maybe we don't need as big of a space, but I think there's going to be an ongoing need, at least for some time, to continue to have some kind of option available for similar patients. The second part is there's non-homeless that also need convalescent and in a facility that might serve both needs. Thanks, Marie.
Well, thank you. Let me just start this. Okay, here we go. Excuse me. I just wanted to get my camera back up. Okay, thank you very much. Let me just ask if there are any questions. Marie, did you want to add anything else before I open it up to questions from the board, especially since we have Dr. Mojan on the line and I know that his time is limited?
You know, so thank you so much, Chair Archuleta. Just that we've really appreciated the partnership with Northern Arizona Healthcare and along with our sheltering partners. You know, I think the general consensus, I have not heard anybody voice differently, is that there is a need for isolation and quarantine operations. The difficulty is right sizing it, finding a cost that can be borne, and really determining how long these operations are needed, which none of us know. So really just appreciate the conversation today, and that I would leave it to the board. And then in respect of Dr. Mojan's time, I do have other items to share in terms of what county staff have done to reach out to other hotelers, but I can share that after the discussion with Dr. Mojan. Thank you.
And Marie, I guess I'd point out one other thing is that and correct me if I'm wrong, but I think the census has been flat to maybe increasing a little bit, and that may represent more homeless in our community with the warmer weather compared to the very cold weather we were having at the beginning of COVID-19 infections in our communities. So
that's absolutely right. We have seen an increase in our census, and that is one of the concerns as the weather does get nicer and as people are traveling up from the valley area, as we typically see an influx this time of year anyway.
Right. So if we were seeing a tapering off, it'd be a different discussion, but I'm just concerned that we're seeing, I think the 18 residents that you have there is about as high as we've been, and it seems to be trending up rather than down.
Correct.
Well, at this time, I'd like to open it up to any questions from the members of the board regarding Hotel Aspen. And I know that we do have this on our agenda for the next item, but we're taking, I think it'd probably be good to get the discussion about this item, the Hotel Aspen, since we do have Dr. Mojan on the line in terms of projections of use, et cetera, so that we can be better informed for item number 13. This is part of the COVID update, and Hotel Aspen is part of it. So I think we're fine with our agenda considering this item at this time. Any members of the board that wish to ask any questions about this item?
Madam Chair?
Yes, go ahead, Supervisor Babbitt.
Thank you. So thank you, appreciate you being here today. And so a couple questions on the FMC side of the equation here. And I do have some that are specific to Aspen, but then a couple others that are not, since we really appreciate, having the ability to have a dialogue with you here. So can you tell me the general lay of the land for testing availability in the hospital? Do you have adequate tests for patients coming in who are presenting either through ED or who are just in the hospital, regardless of whether they are critical care, ED entrants, but just you have adequate testing that you're being able to do?
Yeah, so I'd answer that in two parts. I think we're able to test whoever we want.
Okay.
As far as inpatients, so we've maintained the capability of testing within the ER and the emergency room, et cetera. Some of the tests that we do are to clear people to go to a skilled nursing facility or long-term care facility, which requires 2 additional negative tests, which can turn into 5 tests because if one of those is positive, then we try again. So there's a lot of testing going on. We recently got a rapid testing ability, and we had like 50 tests. 10 of them we had to use to test the system, and then 2 we have to burn every day. So it ended up being not very many, but we have a lead on getting more of those. What that helps us to do is determine whether if a patient came in through the ED and we tested them, we knew they were positive, they could go on one of what we call contained units, or units that have all COVID-19 patients on them. It also helps us if a patient needs to go to surgery, we do different precautions if we know they're test negative rather than test positive. So we've kind of used those few tests we have for those specific populations. Now we have had our testing ability overall, the number of tests we have has expanded, which is good, but a lot of the tests we received are nasal swabs, which aren't as good as the nasopharyngeal swabs. And we no longer have tests for flu and RSV. We ran out of those. So while I think for COVID-19 specifically, we can send out tests to Mayo, which was what we're doing for our inpatients. We have capacity and feel fairly good about the ability to test our inpatients. We've been able to expand our outpatient testing to include those at risk and symptomatic folks up to all 4 tiers for about the last 2 weeks, but we had to limit it before that. And we have continued to help with the Blitz testing and the Fort Tuthill site as well, and set up a testing site at Verde Valley Medical Center as well. So as far as testing, we're in a better place than we were before. We're limited on the rapid tests. We're limited on flu, RSV, which can also be used for COVID testing. So there's certain types of tests that we'd like to get our hands on that we haven't been able to, especially as we prepare for, quote, second wave or whatever the fall brings. We need to get in a better place around those tests.
Great. So that's super helpful. And the reason why it relates to Aspen, at least from my perspective, is trying to get a sense of how many medical referrals there are to Aspen who are awaiting test results versus who are positive. As you, I'm sure, know, the county got its Abbott rapid testing, which I'm sure is probably the same machine you're referencing. There have been some challenges with accuracy on that, which I think seem to be, being mitigated a little bit. But it seems to me, if we are sending a fair amount, and we being the collective continuum of COVID care of this population, if we are sending folks to Aspen and then needing to wait 5 days to get results, or 3 days, or what that is an incredibly, incredibly expensive window. So let's deploy the limited, at least from the county side. I understand why someone going to surgery, you have to use that Abbott for that patient. You know, the people who are caring for that patient need that. But for the referral, let's use the county's resources on the rapid testing, because if they do not need to be in Aspen, it is an incredibly expensive place for them to be. And so that question would be, how many who are referring from FMC are unknown of their status and waiting results?
I would say the majority of those are awaiting results. So they get swabbed in the ED, for example, and then they wait. We're using Mayo Clinic, and during the middle of the week, the turnaround is 1 to 2 days, so it's good. Not an hour, but 1 to 2 days. It's over the weekend where they don't test on Sundays and they don't have a courier after midday Saturday that really we get this delay. And so one of the ways we might be able to deploy the rapid testing is for those weekend gaps to just narrow that gap, and even for some of the other testing we do. Okay. We're using the Cepheid system, which is a more accurate, I believe, or at least that's what kind of the word on the street, so to speak, is compared to the Abbott.
Okay.
But because of that, those tests are super popular nationally and harder to get our hands on, if that makes sense. I did appeal to the senator's office, and they were helpful in us supposedly getting a shipment of those coming in this week.
Great. So I think that's really helpful to me to know that the majority of folks who are getting referred are really in a holding pattern pending results. And that doesn't mean all, but that means quite a few of them are. So that's super helpful, because I think there are some things, as the supply chain of rapid testing maybe loosens up, that's a great way to help mitigate that flow into just an incredibly expensive facility. And then the last thing, wanted to just check in. Well, I just wanted to appreciate the data that FMC is sharing in its dashboard
Thanks.
every day. I reference it. I do quite a bit of social digital presentation on stuff. I reference your critical care capacity numbers, your overall capacity, and have just been and talk with a lot of folks and realizing that the critical care capacity, still you have 30% room in those 55 beds, that the overall capacity is just over 50%, is really helpful for us to be able to enunciate. That's one of the biggest questions I get as it relates to the overall carrying capacity of our healthcare system to serve not just COVID patients, but the regular stream of patients that come in. So that's been helpful, and I think it's actually been good and meaningful for the community to get a better picture of what's going on the capacity side.
Yeah.
So I want to thank you for that.
Oh, you're welcome. I'm glad that's useful. We're trying to provide data, to NAU, we're providing data to registries, so we understand this going forward and over time too. So there's a lot of work going on behind the scenes to try to learn, share and learn.
Yeah, and it's just reassuring to people know that we've never, at least as my recollection is, the last 2 weeks, we've never fallen below around 25 to 35% free bed capacity in those 55 critical care beds. And that's important for people to know.
Yep, and it's actually bounced up the last few days. We've had a lot of sick patients come in. So we thought we were kind of trending down a little bit, and now it
went up to 39 this morning. I check it every
you looked. All right. Yeah, that's correct.
Thank you.
Are there other members of the board that have any questions for Dr. Mogen?
If I may, Madam Chair.
Please go ahead. This is Supervisor Ryan.
Thank you, Madam Chair, and thank you for the relationship and what we've been doing together, Dr. Mugen. One piece of it is understanding that we needed to stand up this facility quickly. There were limited resources, and we did. Now that we have a chance to absorb the impact, understand what it is, seeing that we don't have the numbers, we do have a larger facility than what we need, and it is quite consumptive in terms of our own financial capability. So it is a time for us to really relook at this, see how we might be able to retrofit the model, and see what options might be scaled more appropriately for what we're looking for. In doing so, and I'm not sure if you can answer this question or not, but is there any chance that the hospital, the medical facility, and corporate would, to some degree, potentially share in the cost of another scaled back model that we take a look at?
Yeah, and that's something that Flo Spiro and myself and others have had some conversation around. And, we were potentially going to reach out to the foundation. I don't think they have the kind of money to dent the cost that we're seeing now. More likely, what we could provide is either a resource for some of the costs associated with it, whether it's actual building to have these patients in, or resources for security or biohazard or EVS, environmental services, cleaning, etc. Because financially we're getting creamed, to be perfectly honest. It's been a rough few months for us. Our revenue is, for 40% of what it should be or less, and we're taking losses month over month. So, and not small losses, huge losses. And that's, you know, caused us to make a bunch of other sacrifices around how we operate. And there's just not extra money right now, and unless we saw some kind of support that we're not expecting at this point.
Okay, and in understanding, yeah, we're all doing that right now. We as a community, as well as we as organizations, on what's happening. So there's a potential, at least for a conversation of, if not direct, there might be auxiliary opportunities, but that needs to be explored.
Absolutely.
Okay.
Yeah, we definitely want to be a good partner and help in any way we can. So look forward to those collaborative opportunities.
Okay, and it's a factor. We have to pause and take a look at where we are right now, and same thing. If we continue to operate at this point at this rate, there are many other areas of service that we function in that will be compromised, and we have to look at the greater community, the larger populations associated with the not only what we're doing as an organization for the sake of the community, but more perhaps more for responding to the impacts that we see in the future as well. So but really appreciate all the work that you've been doing. I hear, I haven't been in the direct conversations, but a lot of compliments to your participation and organization's participation with our group as well.
Appreciate that.
Thank you.
Madam Chair?
Yes, go ahead, Vice Chair Fowler.
I thank you so much for joining our meeting today and giving us an update. I'm just wondering if you, how long do you expect this housing that needs, how long do you expect that we need the housing like this?
Yeah, it's one of those $1 million questions, right? I think we should be in a better place based on projections in probably 60 days. I think there's a lot of unknowns as we open up. What are we going to see a second wave or surge as people leave their homes and are interacting more? I think if we do things the right way, we can mitigate a lot of that. We also expect that the number of cases that we're seeing coming off the reservation should decrease over time. I think they're leveling off and decreasing in certain pockets, but there's still microclimates that are seeing quite a few new cases, especially in the far northeast, that then we're getting patients referred in to our facility. And some of those may not be able to return home right away and need somewhere to convalesce. I think that's a little bit different conversation than our local homeless, which I think there's a low prevalence now, but we're seeing a few extra cases start to pop up, particularly in the last week or so. So I think we're in this for a month or two more, and to be completely honest, that's an educated guess, but it's still a guess.
Yes, I think we are all still in the uncertain times, and we don't know where it's going to go. But yeah, we just have to project and try to see how we're going to handle all these cases and where it's going to take us. So thank you so much.
Mm-hmm.
Madam Chair?
Please go ahead, Supervisor Parks.
Yes, thank you, Madam Chair. Dr. Muchin, I was wondering, first off, thank you very much for all that you have done and all the Flagstaff Medical Center has done for the situation that we're in, that you have absolutely shouldered this burden and brought us to where we are now, and flattening the curve and that you have mentioned, that is good. I'm sorry to hear that we may be having a few more positive cases show up. I kind of assume with that may be due to the increase in testing. Is that true?
Yeah, I think when we look at our rate of positive cases, there's still at least a local Flagstaff proper is seeing about the same incidence of positive cases. So the more cases we see is partially due to increased testing. I think one of the things I was mentioning is that when we were first sending people to the Aspen Hotel, for example, and they were undergoing testing, a lion's share of those tests were coming back negative. I think we're seeing a few, and it's anecdotal because it's low numbers, but we're seeing a few more positive tests in that population than we had been seeing over if you compared that to the previous 3 weeks over the last week or so. So I think we'll know a little bit more whether we're seeing a higher incidence, but what we're really trying to do is prevent a major outbreak, whether it's in our detention centers or shelters or nursing homes. I think all those things are critical, and we've done a pretty good job of it. And so I think we're to be credited, the county and the healthcare providers and the local institutions for doing a good job of keeping that from happening. And I think I just want to maintain that record and keep us from having any major problems going forward.
Thank you, Doctor. I also, one other question. You alluded to the fact that we have about 60 days to wait to see how things are going to pan out here. And with the Hotel Aspen, I don't think we can afford at the price that we're paying. I don't think we can afford to go forward the way we are for another 60 days. I think that we need to back off.
Yep.
I would like to see, we have to take care of this population, but in all honesty, we're wasting most of the rooms in that hotel every night. And so at that price, I would personally like to see us back off to a case-by-case basis, if we could, in housing this population. I don't know if that's possible, but I assume that we can work something out with not just the Hotel Aspen, but perhaps other hotel facilities in the town. We have a town full of hotels, and they are not doing any more business than Aspen Hotel is right now. I thought we were going to wait for this conversation for this afternoon or later on, but as long as we're in it and you're on the line, what is your projection for the increase in the number of cases? If some of the models that we had in the beginning of this crisis have proved to be very inaccurate. Are you and the NFM, are you considering models that perhaps would be more accurate in your projections for what we're looking at for the new?
Yeah, no, I two things to start with. Number one, I appreciate the fact that this is expensive, and I don't want to come off as NIH doesn't appreciate that something has to change and that it's not something that we can sustain. And I did not mean to suggest that the Aspen should remain as is for 60 days. I think the question I was trying to answer is that we'll probably have some kind of need for that long and maybe even longer. And I just hope that kind of it's less and less patients by 60 days. We may not need a major facility, and it may be down to maybe less than 10 people that we'll need to house. As far as modeling, I think what we're looking at is that as we open up the state and people begin to travel to Flagstaff from Maricopa County and Pima County, we see that intermixing that may cause the disease to ramp up. And so if that's done mid-month, then potentially those cases start to come in or raise up through the end of the month of May. And then we see hopefully a plateauing and decreasing over the month of June. And granted, this is I get as much information as I can, and I listen to smart people, and that's what I'm told. But I don't know that, you know, we can hang our hat completely on that. But that's the best model we have, and that's kind of the rationale behind the 60 days.
Okay, great. Thank you, Doctor.
Well, thank you so much. So I think I'll go ahead and go next. It looks like every member of the board's had an opportunity to ask a couple of questions. We really appreciate your time. So, so understanding that the board does need to provide some direction today regarding Hotel Aspen, and hearing that obviously the costs are great. I think I just want to make sure that we have the context of what, since we get referrals from, one of the referrals is from FMC or NIH, what would happen if we did not have a hotel to be able to send patients to? What would be the result of that?
Well, I think, you know, that if patients showed up here and we got tested, we tested them, that the biggest risk is they'd be discharged back to the community. They'd either be difficult to track at that point, or they would try to re-enter the shelters, either lying about their symptoms or the fact that they've been tested, and get by whatever screening procedures they have there, and then infect others. The other thing is that even if they don't go back to the shelter, they may be interacting during the day with other residents of the shelter, you know, which can happen now still with the Aspen, but maybe less so by that physical separation. So I think that's the biggest risk that we have if we were no longer to do that. I think we wouldn't just leave it at that. I think we would look for other alternatives, whether that's partnering still with the county in some other way, or the sheltered services, or you know, even if we had to design something ourselves. So I think we'd look at all those different alternatives. I just don't think, you know, we would be able to support a large population at all of those types of patients. Mm-hmm. By ourselves.
So these would be people that would be not like acutely ill. I mean, obviously, if they were ill, they would stay in the hospital. But these are people who perhaps are. Would they be folks that are showing symptoms, or not necessarily? I guess I'm just trying to understand the level of illness.
I think that would be probably symptomatic for the most part. As you well know, there's, you know, a spectrum of symptoms we can see, from cold symptoms and a cough and fever, to lots of body aches, fatigue, to the needs for hospitalization are based on more shortness of breath, and oxygen levels, laboratory findings, etc. So a majority of the patients still can be discharged safely to shelter and isolate. And so I would assume that shelter population still would have a majority of those that get tested would be able to be discharged.
Okay. Well, thank you for that. Any other questions, members of the board?
Madam Chair?
Yes, go ahead.
Yeah, so we just so I'm clear, so we will be following this conversation up with the policy direction conversation, correct? We're not having that now, correct?
Correct. Well, we do have item 13,
right,
which is scheduled from 11:15 to noon. I mean, we certainly could reorder the agenda if you'd like to just continue with this conversation and do that, or we can continue with item number 12. I mean, Dr. Peoples gave this update within we're speaking about this in the under the update.
Right, not the action and possible direction.
Right, okay. Right. But again, I mean, we could reorder the agenda and go into item 13 right away, or we could just finish out the update and the possible passing of the proclamation, and then we'd go directly to this item.
Yeah, okay, that sounds good. I did have one last question, because I think it relates to this, and I'm totally comfortable with just leaving it as finishing the update and then going to Hotel Aspen conversation. And I am certainly, online with the fiscal capacity of us to continue how we're doing this. Utilization has been super far below capacity. So it's really appropriate. We look at this, but we do it thoughtfully and we do it meaningfully. I did want to just share something on the how we try to ensure the right people go to the right facility, and it should be noted, Flag Shelter Services is, they just had North Country partner with them to test all their hotel guests and all their shelter guests. That is incredibly important. We, as the county, needs to be an active and supportive partner in that endeavor to make sure that those who are caring for the broader population are absolutely engaged with meaningful continuum of care, understanding of the reality. So it's really, really important that the county step up and play a really good role in that. I think that rapid testing piece could be really effectively prioritized for this population, since so many are going in kind of a holding pattern. And if you look at some of the symptoms that are coming from COVID-19, people who are chemically dependent, people who are homeless, people who are at the margins. If you look at those symptoms, as someone in recovery myself, many of those symptoms were part and parcel of how we lived our lives. And so it's really hard to say, ache and fatigue. Try being homeless and chemically dependent, So I think it's really important that we get our hands around providing meaningful methodologies to really support this population in effective programming, but also in terms of being fiscally responsible in how we do it. And I think it's been really helpful. I love knowing that the majority are coming out with not a positive. That really, to me, helps frame the conversation. Thank you.
Hi, Madam Chair.
Yes, go ahead.
Thank you. Just a point of clarification. As Dr. Muchin indicated, is that in the early beginning, we were seeing more negative results, but that has changed over the last couple of weeks where we're starting to get more positives. Of the 19 that are currently there, we have 9 that are already positive and 6 that are pending. So we really are seeing an increase within that population. And I realize that those are still low numbers in the grand scheme of things, but the fact that we're seeing the increase and the creep up of the positive test, it really is indicative of really what we're also seeing overall with our testing numbers. And we'll know more once we get the Saturday Blitz numbers and the state starts releasing what they've received from across the state as well. But as I do my update later, outside of the Aspen population, we'll see that our cases across the county have not declined significantly on any given day. So
Yep.
Just wanted to share that. Thank you.
I think that's a valid point. We're seeing more positives. And I believe if they are negative, then they're discharged from Aspen. So we get a skewed number of positives because the negatives are then discharged and sent out. But it was, I think 9 might be one of the higher numbers we've had residing at Aspen that were positive at one period of time. So that number seems to be climbing. And the reason why we keep the positives is to keep them sheltered from the rest of the population until they're far enough out from their infection so we don't think they're contagious anymore.
Mm-hmm. Mm-hmm. Well, thank you. Yeah, and I did hear that clearly as well, that there seems to be, we believe there'll be a projection of increasing positives. So appreciate that very much. Okay, well, if there are no further questions for Dr. Muchin, I know you have a lot going on, and so we really appreciate you joining us.
No, I appreciate all the thoughtful conversation, questions. I think you guys are asking the right questions, and certainly appreciate being part of the conversation. So that makes us feel very involved and part of the solution finding team. So thank you for including us. And if there's no other questions, I'll sign off.
Okay, thank you very much.
Thank you. Have a great day, everyone.
You too. Have a good one. Dr. Peoples, did you want to go ahead and finish out your update?
I would like to. Could I have just like 10 seconds, Madam Chair, to switch
Yes.
screens? My
Yes,
technology is not working with me. 1 second. Thank you.
Of course.
Thank you so much. I appreciate you waiting. Hopefully that's better for everybody. I don't know what was wrong, but do you want me to go continue with the Aspen updates that I was going to share, or start at the top of the update?
Well, let's see. So the Aspen update, you're not talking about item 13, right? You're still talking about Aspen update within the item number 12, the overall COVID update.
Yes.
Okay.
But just
yes.
for continuity of conversation, I'll go wherever you would like.
Okay, why don't we just go ahead and finish out item 12, just the overall update, and then we can dig in a little bit deeper when we get to item 13 regarding the Aspen.
Madam Chair.
Yes, go ahead.
Can I just throw a thought into that? I just want to say thank you to you and the board for your flexibility in accommodating Dr. Mugin for him to be on this morning, and thank you, Marie, for helping to arrange that. Rose Winkler is on, especially we get into questions regarding the proclamation as part of the updates to help with answering those questions as well. So thank you very much.
Okay, good. Well, then I think we should continue with item 12, and then we can move on to to item 13.
Excellent. Thank you so much. So again, Madam Chair, members of the board, we are in week 8 of the full-scale COVID-19 response. As you all know, this has been a one-county response. We've had many departments and individuals representing those departments that have been involved in the Emergency Operations Center and in all the different events. And so we continue to be grateful not only for that, but for the county manager's office and for the Board of Supervisors support as we really move through these uncharted territories. So thank you for that. We have 552 positive cases currently, with 29 new cases this week. Of course, the week is not ended and we don't have our Saturday testing results back yet, so we don't know where we will stand. We have 959 pending tests. And we currently still have a 20% positivity rate. Unfortunately, we have had 46 deaths countywide. And then we currently have 84 total hospitalizations. And as I've shared before, not all of the hospitals report in the same synchronized manner. So sometimes that data is a little bit squishy, but it gives us a good picture of where we're at and the hospitalization trends as well. I do want to share that this past week was the highest number of cases that we've had throughout the COVID event. We had 102 new cases last week. And then before that, we had 84 new cases. I do have a chart, if I could share my screen real quickly, that I wanted to be able to show some of the data. Can you see that, Madam Chair?
I cannot see it.
Okay, I will move on and figure that piece out in just a moment. So I'll give some information on the testing blitz as I move forward. So as everybody knows, that the Arizona Department of Health Services, they announced a testing blitz that was going to take place on 3 Saturdays. So we completed our first Saturday this past week. We had 287 people participate. Of those, we were able to have 2 sites that stood up. We were able to stand up at our King Street location and at the Fort Tuthill location. At the Fort Tuthill location, we had 2 lanes, driving lanes. And then at the King Street location, we had 2 driving lanes and we had a walk-up lane. This coming Saturday, for many reasons, we're going to consolidate to just having it at the King Street location. We saw a lot of foot traffic, people biking and recreating at Fort Tuthill, with it being Mother's Day weekend and weather expected to continue to be nice. We expect that more people will be recreating, and so to have some separation We will be at the King Street location. Additionally, that provides a better location for people to bike up and walk up to that's Center City. So we're expanding our operations at that location. We, however, will not be reducing the number of swabbers that we have. So we're still probably going to have even greater access. So we're really pleased with that. We do not have our test results back from the Blitz, and unfortunately the state has shared with us that there is a delay. Our staff is working with them as rapidly as possible, so I can hopefully have some confirmation for the board to let you know when we will have results. This is incredibly unfortunate. These are some of the concerns that we had going into the event, was being able to give people results in a timely manner. And at this point in time, we're working with the best we can and what we have. In terms of regular testing sites updates, we are continuing to test at the Fort Tuthill location Monday through Friday, 10 a.m. to 3 p.m. Unfortunately, those dates are not, or excuse me, that site is not open to everyone like the testing blitzes. There really is no criteria for the Saturday testing blitz. It's open to anybody who thinks they may have come into contact with COVID and been exposed. Our Fort Tuthill operations, the Monday through Friday, 10 a.m. to 3 p.m., it does either require doctor's orders or for somebody to be symptomatic. There are providers on site that are doing the symptomatic screening so people can still have access. Our number of tests there each day have increased quite a bit over the last couple of weeks, so we're seeing an uptake in that. And then I also want to share, so we have done testing 2 times in Tucson, we've done testing 2 times in Williams, and then we were in Fredonia last week through partnership with the Sheriff's Office. I believe Supervisor Babbitt had mentioned the all testing that is going on at Flagstaff Shelter Services, which is terrific. We did reach out to all of our sheltering partners over the last couple of weeks to plan dates to schedule with them. Flag Shelter did let us know that they were partnering with North Country, which was terrific because that adds capacity to the community. Today, I'm pleased to share that staff, in addition to doing the Fort Tuthill site, they are at Sunshine Rescue Mission doing testing for anybody who wishes to have testing. And so we're continuing to offer testing availability at specific locations such as that. We've also reached out to some of our skilled nursing facilities. We've also reached out to some of our DD homes across the county, and there's quite a few. And those types of settings are where we are considering deploying our Abbott rapid testing machine. We did get in a shipment from Arizona Department of Health Services of Abbott kits. We got 150. Plus we had the 24 that it came with. So we have 174 minus the ones that we have to just burn regularly. But that still allows us a great opportunity to be able to go on site to some of these smaller settings, such as the shelters and the DD homes, to be able to give rapid results. So we're really continuing to try to be community facing and integrated by offering those services so that those populations either cannot get to Tuthill or where it's just inconvenient because of medical situation or housing situation, we're trying to partner there. The other item that I will share is recovery numbers. There's been a lot of interest in why we're not reporting recovery numbers, and we've really tried to dig into that and work with ADHS to determine how can we report recovery numbers? What is the metric? So ADHS has provided us some language that we're going to look at and consider, and I'll email this to the board later today so you have it at your leisure, but I'll go ahead and read it. The response word for word that we got from ADHS in terms of considering a recovery metric is, we are currently looking at creating a survived definition. It will likely be individuals who have not died of COVID-related causes at the 60-day out mark, either from the collection date or the report date. We will share more specifics about what the COVID-related causes and codes will be once those are finalized. So I wanted to share that because it's something that has been of community interest, and we are continuing to pursue it. There's just such a wide swath of ways that people are calculating it, and we want to have a consistent measure, and we would like the Arizona State Department of Health to be a leader in that space so that when people are looking at websites and county to county, they can compare apples to apples. So again, I'll email that information to you. Thank you. So I'm told that I can now try to share the chart data with you. So I'm going to go ahead and try to pull that up again so we can look at that. Okay. So what you should be able to see are the weekly case counts among Coconino County. And so what this really shows us, what we have here are the confirmed cases, hospital admissions, and deaths, and they're in different shades of green scale. And I will also send this out and we'll get it posted on the website as well. But what you can see, so for the confirmed cases, that darkest green and the tallest chart there for people that may be listening or can't discern the colors, what you see there is that we have not had a decline in cases. The only week we've had a decline in cases is that week of April 25th. The week prior to that, we had 94 cases on April 18th. And then the week of April 25th, we had 84 cases. And then last week, May 2nd, was our highest week at 102. So in terms of what CDC is saying is best practices and having a 14-day decline, and I realize this is by week and not day, but even if we do it by day, we have not had a decline. So we are not showing that downward curve. We're not seeing a huge trajectory, in cases, but we still cannot show that we have had that decrease, which is quite concerning as we talk about reopening. And then I'll show one more chart here. And so what you see here is COVID-19 cases by geographic area. The largest spike and increase there is that top line that you see in yellow that is tribal communities. And you can see that our tribal communities have just been really hit hard with cases. And of course, we are all interconnected. And so of course, it does not just stay within tribal communities as we co-share lives. And then you can see the page cases. Those are in the lighter green. And those also, of course, have had some ups and downs. And then the Flagstaff area is, and I'll take my cursor, I'm not sure if you can see it across, but the Flagstaff area. So we've had 10, 12, 11, 10, 9, and then we had a spike of 17. And again, we don't know where we're standing at for this week. But all that to show is that even within Flagstaff, we're not seeing that downward trend that we really would like to see, or what all the science experts across the nation are saying that we need to see prior to massive reopening efforts. And that, Chair Archuleta, is really all I had. Thank you.
Go ahead, Supervisor Ryan.
Thank you, Madam Chair Marie. Just curious, I'm sure you told us this before, but everything changes to some degree. The numbers, since we're probably going to get spikes with visitation coming in, we're going to have different zip codes that will be tallied in this area. Is that separated out? Could you remind me of that? Or is there a way that we might be able to see how these surges might occur? Can't hear you.
Sorry about that. Yes, it is separated out by zip code. The daily charts that I've been sending has that information, and we can do some of the 14-day plotting by zip code. It gets really busy and full by doing that just because we have so many zip codes. It's almost better to lump them within certain areas, like the page, Flagstaff, and looking at it that way. But we can look at it in a multitude of ways. But as you said, Supervisor Ryan, and thank you for the question, with individuals coming into the community to recreate, with the influx of, which we normally see this time of year anyway, the transient populations, whether they're coming from the valley or other areas, we see that increase. The hospital numbers are quite interesting. We're seeing shelter numbers go up. And then again, as we've already talked about, the Aspen numbers, seeing more positives there. So it is just incredibly hard to tell. But I think the warm weather is a little bit deceiving. People are feeling better. They're wanting to get out and about. Again, I wish I had those testing blitz numbers to share with you, especially the statewide numbers, because I think that really is going to be a key indicator.
Yeah, and that's where I'm kind of going with the zip codes. We don't have Phoenix separated out into the zip codes, if I remember reading more recently our numbers. And that's kind of where my question's starting to go, looking at those transient populations.
Yeah, thank you. And I'll dig into that and see what we can get more in terms of zip codes and the other larger metropolitan areas as well, and see if that can help inform the discussion.
And just for clarity, for the sake of those that are listening, so if they test positive, even though they're out of our area zip code, they would be listed in our area zip code. Is that correct? Or
No. Thank you so
Okay.
much for asking that. I apologize if I didn't understand that. So no, if people are testing here and they are positive, we're doing the disease investigation, their cases are counted in their original zip code. Just as an example, this weekend, working the Blitz, I don't know in total how many people came from outside of the county, but I know that I personally did intake on just a couple of people that came from outside of the county and a couple of people that came from outside of the state. Those cases, whether negative or positive, will be returned to their home jurisdictions.
But for our sake, that they're here and they might be positive, that's the piece that if we knew that, it might be helpful in our own, how do we mitigate potential impact here?
Absolutely, you're correct. I mean, just people coming through the community, even if they don't intend to stay here, if they are positive, then that contributes to our community transmission.
Thank you, Madam Chair. Thank you, Marie.
Any
Yes,
other
absolutely. Thank you.
questions oh, Marie, did you want to continue or any other questions about maybe the data that she's presented thus far? Okay, go ahead, Marie.
Yeah, so now I'll just go ahead and dive into the Aspen numbers, and then I think Kim has an alternative care site update.
Okay.
And so as I had shared earlier, the Hotel Aspen, the 3 populations are COVID positive homeless individuals and those awaiting COVID-19 results. Homeless individuals who are 65 years or older and at elevated risk for COVID-19, and then first responders and healthcare workers who need sheltering options. That last category has not been a category that has really been served. We have opened it up to those individuals. Northern Arizona Healthcare has what they call Taylor House, to where their staff can go stay, and it just has not been a big taker. We have offered it, but and that's a good thing. Fortunately, there are other options for healthcare workers as the community tries to take care of this very important population. We have had a first responder who rejoined our community after being deployed in New York for quite some time. So we were proud to be able to serve that population. But for the most part, it has been homeless individuals and sheltered and secure individuals that have been there. We have had 84 guests to date. Currently, we have 19 guests, of which I shared 9 were positive, and then we're pending test for many. And then we have 65 that have been discharged. Total cost for Hotel Aspen is $630,000 and some change. That equates to about a $7,500 cost per person, I believe. I don't have the math in front of me, just doing quick math in my head. What I will share about that, I had provided some earlier information in your emails and probably have shared it in another board update. That seems like an astronomical cost, and I agree. However, when we look at hospital costs for individuals that do not have insurance, the hospital costs are upwards of $100,000. And so there's a lot of different social connections there. And so not only are we flattening the curve, hopefully it really is taking the burden off different safety net systems, including the county. As you know, we operate many safety net systems. And then in terms of people that are insured, the costs were running upwards of $50,000. So unfortunately, COVID is just proving to be incredibly pricey for local jurisdictions as well as state and federal as well. So I do want to share some good news about the hotel operations, which certainly does not detract from the overall cost burden. But I emailed the board last week, I believe. I apologize, all the days kind of melt together. But West Deason in Logistics was able to renegotiate our biohazard cleaning contract. I sent specifics about that. And so we were really pleased with that. And so that will hopefully help us a lot with costs moving forward, regardless of if we move to a smaller hotel operation, larger operation. But if these operations are continued, that will be a benefit. I also want to share that staff did their due diligence by reaching out to 19 hoteling partners that represented 20 plus hotel owners within the community. I did provide those costs back to you in your email. I won't go through those in this presentation. We are still waiting responses from many of those, and some of those indicated that they're not interested or it's not something that they could support. So there are, of the 5 hotels that were willing to provide services to this population, they had capacity for in between 20 to 60 rooms. and the cost ranged from $41,000 to $126,000 monthly. There are some different caveats with that the staff, after receiving some guidance and direction, would continue to explore, such as utilities and access and security and that sort of thing. But wanted the board to know we continue to parse those out and to see what types of options may be available should these operations want to be continued. And then from our current contractor, you'll also see that he did provide a new reduced rate should we be interested. So that information is in your email as well. With that, Madam Chair, I don't have anything else to share. If there are not any questions, then Ms. Musselman can move forward with her alternative care site update.
Thank you. Let me see if there are any questions from the board at this time. Okay, well, why don't we go to the alternative care site?
Thank you.
Hey, good afternoon, or I guess it's not quite afternoon yet. Good morning still. Can you hear me okay?
We can. Thank you, Kim.
Great. Are you ready for me to proceed, Chair Archuleta, with
Yes.
an alternative care site update?
Yes, please. Thank you.
Great. Thank you. So last week, Supervisor Archuleta, County Manager Jane, Dr. Peoples, and myself had a great conversation with several of our Northern Arizona regional hospital providers last week, including Dr. Mujin and Dr. Ritchie, Dr. Mujin from FMC and Dr. Ritchie from Chinle Hospital, and several others from other providers in the northern region, even outside of our county. And we also then took this conversation and continued it even further at the clinical leaders provider group that took place a couple days later. And I just wanted to share that the overall consensus after talking, we had entered into these conversations because there had been questions both from the state as well as internally and from our provider community about the potential of the Walgreens site and whether or not that truly appeared to be a practical solution for what the northern region is in need of at this time. And out of those discussions, it did not appear that the Walgreens solution is a practical solution right now for what the larger need is, which has been described by all of the providers as being a location for skilled nursing. And what that is a location where patients who are ready to be discharged from an acute hospital setting, but still require nursing care and hospitalization and rehabilitation services to help people get back on their feet and recover from COVID. Those are the types of facilities and beds that are not readily available, especially in northern Arizona, and largely due to concerns of many of those organizations not wanting to bring in potentially COVID positive patients into facilities where there are non-COVID patients, and that's certainly understandable. So as we talk through the solutions that are currently in place and also look forward to what other potential solutions we may want to explore, I would just share with everyone the St. Luke's facility that is an alternative care facility that is being stood up in Phoenix. They are working still to continue to build it out. It was supposed to be ready to hand over keys this past weekend, but apparently they ran into some delays regarding some electrical issues. So that building, the build out is still ongoing. They were also mentioning that they were updating some costs, which would need to be approved. They're also still looking to find a provider to come in and respond to the RFP that's been put out to provide services in that facility. So that is ongoing. Hopefully they will make some significant progress in the next week or two regarding the providers for the services. The other piece that's been in place that our local providers have been using to a great deal of success is the surge line, the Arizona surge line. And that is a line that was developed for hospitals and other providers to call to triage patients and patient needs, to know whether or not they have a facility that is appropriate to be able to transfer patients to that with COVID, whether that be somebody who is on a ventilator. Certainly FMC is receiving a lot of the higher acuity patients that are coming out of other areas in the northern region. And then this is also an opportunity for FMC to be able to use the surge line to look at alternatives for discharging patients to other types of levels of care throughout the state. At this time, all the providers had reported that that is seemingly serving to be a very useful tool, and they are going to continue to use that. In the meantime, wanted to advocate that there's still this desire to look at other alternative care solutions, but specifically around the skilled nursing and the long-term care type of facility. Sorry about that. So basically where we're at, and with some next steps, I know that Supervisor Archuleta has also shared with other officials around Coconino County and throughout the cities and towns kind of where we are with this. And we're scheduled to have a meeting tomorrow with the state, with Arizona Department of Health Services tomorrow morning, to kind of talk further about what our needs are. Some of the interesting pieces that are part of this are in the traditional alternative care model, there's funding that comes directly from a federal source. And so when we talk about building out a place like a warehouse and you bring in the Army Corps of Engineers, that typically comes with federal funding upfront that allows for those types of physical build outs to take place. In the sense that we are not looking at the Walgreens facility or that type of a temporary hospital type facility as being what we currently need, there's a few other interesting obstacles that come forward with respect to where does the funding come from and when and how and who does that flow through. And so I will just share with you that in my conversations with Rachel Garcia at the Arizona Department of Health, and she was going to be having additional conversations with Dr. Kara Christ this week in preparation for our meeting tomorrow. But really the concern about the county is not in a position to fund and to front money to get operations, even these skilled nursing type of facilities, up and running. I mean, as all of you are fully aware, we're talking about the Aspen Hotel and the extreme cost to the county. We do know that with that, we are eligible for some reimbursement, and we are actively engaged in working through that. However, you know, this is another piece that is another financial burden. So one of the specific asks with our conversation with the state is, how are we looking at other options to explore some of these things that maybe need to be put into place with some of our skilled nursing facilities or rehabilitation facilities that come with appropriate incentives to do so, and that is funded either through the federal resources or through the state. So I look forward to continuing those conversations and providing you updates. And with that, I'll stop and ask if there's any questions or a point of clarification.
Thank you, Kim. Are there any questions for Kim at this time regarding the alternative care site?
If I could, Madam Chair.
Yes.
Kim, so what does that look like? Has the conversation been, developed to a point of what does a skilled nursing site, what would be required of something like that?
So the conversation has developed somewhat. One of the things that needs to happen is certainly one of the concerns that's been voiced is, we have skilled nursing facilities in Northern Arizona, not a whole lot of them. There's obviously several more available and with capacity down in the valley and other places in close proximity. The concerns are that many of those facilities, and rightfully so, are scared to be taking COVID positive patients or patients that could still be shedding the virus into a setting that also has non-COVID patients. And so the conversation has been around talking with the state about are there incentives that can be put forward to look at options of cohorting COVID positive patients in one particular facility or one or two particular facilities, while obviously keeping folks who are not COVID exposed separate from those who may who do have the virus. So those are definitely conversations that the state is very interested in. I will share with you that in our conversations with them, and we've been kind of talking about this for the last several weeks and sharing with them and floating different ideas. And I say we, meaning Coconino County directly, in some offline conversations with many of them down there. They have actually started engaging in those conversations. They even have a new graph and model that they are already entertaining, which specifically speaks to the things that I've just said. So I'm really looking forward to see where they have gotten over the course of, we had a conversation late Friday, so they were, Rachel was trying to catch up with Dr. Chris, hopefully yesterday and today. I hope to know more tomorrow. They certainly know what our desire is and where our concerns lie from the northern region. And we continue to have those conversations and see where that gets us.
So just staying with that real quick would be, so I'm making the assumption that they basically is trying to tap the local nursing resources and somehow having a match associated with that. Where you also have the supporting facilities that go along with it. But it either you don't want to co-mix, or how do you expand the population? So yeah, I'm making those assumptions. That's generally where the conversation is. How do you bring in a resource, have the facility, or tap the local and have the facility and have the separation, sanitary setting, etc.
Yes, thank you, Supervisor Ryan. That's definitely the conversation. And ultimately, looking at this type of option allows for there to be access to existing nursing staff and resources. So that's another reason that this is a positive, a more promising kind of avenue to explore, rather than building a whole separate facility that currently staffing those facilities is already continuing to be an issue.
Which we don't have with the Aspen Hotel. That isn't in a nursing supported facility.
Correct, and thank you, Supervisor Ryan, for that clarification. All of the folks who are staying at the Aspen are people who are capable of taking care of all of their own activities of daily living. They do not need nursing care. There are some follow-up care that is happening with respect to some telehealth and other things, but the folks that are going to Aspen are not the patients that I'm describing that would utilize a skilled nursing type of facility. And again, just to clarify, that skilled nursing definition, if you will, is a place where it's not solely a nursing home type of setting. It is a setting where patients need additional medical expertise and services, rehabilitation services to help them recover and get back on their feet. Many of the patients that are coming out of the hospital that are COVID positive have a lot of other physical needs that take a long road to recovery. Certainly that's what's been reported from the providers around our region. And so that is why looking at that type of facility and process appears to be a better solution than a warehouse type temporary stand-up hospital solution.
Thank you, Kim. Thank you, Madam Chair.
Thank you. Other questions regarding the alternative care site? Okay, so just so I can make sure that you're going to get from us what you need today, Kim. So what I'm understanding in terms of what the state would like from the county is basically our perspective regarding what is needed for our area, which we have now heard from the hospital providers in the region, and then as well as your phone call with medical providers, is that a skilled nursing facility is what is needed. And we are connecting with different skilled nursing facilities to see if there's availability and willingness to fulfill this need so the state could communicate with them. But I also understand that if we do need this, that then the EOC has to put forth a request. Is that correct? There's a certain form and a request that we have to put forth on behalf of our county EOC, and to fulfill this, to start the ball rolling on fulfilling this need for our region. I also understand that in our phone call with the hospital providers that I did specifically ask them a question about, what about the second round of the virus in the fall? Would this continue to be your need? Meaning, you know, we're hearing you express that skilled nursing facility is what the need is. Would that still be true in terms of your projections for August or for the fall, when there might be another round of the virus, and considering the capacity of the hospital? And I did clearly hear, as all of us were on the phone, did hear that, yes, this would continue to be the need. So my understanding is that today from the Board of Supervisors, what you need is for us to have had this discussion, and then to provide direction if we, for us to make this request of the state, understanding that the original low acuity site at the Walgreens distribution center would not be the course that would be taken. It would be rather site locating a skilled nursing facility in the area that could fulfill the need that is being expressed by our regional hospitals and medical care providers. Is that correct?
Yes, thank you, Chair Archuleta. I think that encompasses largely what the ask of the state is of the county. I would just clarify that one of the options would be not just looking at a skilled facility in our region. Certainly we want to look at that, but also others in nearby and even south of us that could potentially fulfill that need, and that may be outside of Coconino County. So I just want to clarify that. Certainly, and thank you for that. I just wanted to, we have been reaching out to some of the facilities up here. We have initial calls in to just see if they would even be willing to entertain this option should the appropriate incentives be there. Because then at that point, if we have names and contacts for the state, when we put in that resource request that you mentioned, Chair Archuleta, we can indicate that there are sites that we could then have the Army Corps of Engineers and others go do an initial site visit and start some initial conversations. I hope to have more about that tomorrow if the board is so inclined that is the direction that we continue to move forward, and be able to give a little more detail to that. But yes, thank you. I think you've captured that greatly.
Okay, great. Well, thank you for that. So members of the board, having heard that, can you please indicate if you agree that we should proceed with communicating with the state regarding the needs that have been identified by our region, specifically a skilled nursing facility?
Madam Chair, I'll
Yes.
go ahead. My discussion is, yes, we need to proceed with the intent of, we're under an emergency. And so how do you coordinate at the regional level? By the same token, in that, this is it's a situation that keeps changing, and the resources needed, we're under an emergency. The intent of an emergency declared through the state is understanding that local resources would be tapped out, and there would be a need for additional support through the state, through the federal government if necessary, and it's aligned that way. And so we need to step into it cautiously, that we don't tap too many of our own resources. By the same token, responding to the emergency for the sake of what's happening from a health perspective, I support the intent of proceeding and making an application. You're on mute, Liz.
I beg your pardon. What I said was thank you very much. And are there others, members of the board, that feel likewise?
Madam
Yes.
Chair?
Yes, Supervisor Babbitt.
Yeah, so I mean, I'm comfortable, putting forth and signing off on the process and application. I'm fine with, it is, at this point, it is all about the fiscal realities that play out as we move forward, but I'm fine moving forward as at this stage as proposed, and obviously those numbers will play out. Thanks.
Others?
Madam Chair, I'm supportive as well. I'm just, just one, Kim, have you had discussion with the state on the, like the Aspen Hotel and possibly absorbing that as well, partnering with us? Just another question to that,
So thank you for that question, Supervisor Fowler, Chair Archuleta. What I will say is, yes, we have been, so just to reiterate and make sure that all the board is clear with respect to the Aspen Hotel operations. All of that operation has been submitted through DEMA and up through FEMA under the public assistance to be able to hopefully be eligible for what we hope to be complete reimbursement. I mean, certainly that is what the state is advocating for to the federal government. We don't know that yet. We know that we have approval for our application starting on April 14th. We have submitted an appeal to take it all the way back to the date we opened Hotel Aspen, which was March 17th, I believe, and that appeal letter is being sent up through DEMA, as I know we're supposed to see a draft today for that as well. And we also have Monita is working with our federal representative, already looking at submitting for the first quarterly reimbursement, specifically related to all of the expenses that we have put out to through, well, the first quarter will be through March 30th, which will include the initial prorated amount for the hotel, as well as the month of April's charges. So that is in the works to be submitted, and we're hopeful that we're going to see a quick turnaround of reimbursement. So I know that was a long answer to that, but I just wanted to clarify that certainly all of our Hotel Aspen operations, they are being submitted under what is a Tier 1 alternative care model, and we hope to be very successful at getting some reimbursement. I know that the concern and the ongoing issue is that we're having to front all of this money, and it's a huge expense. And so we're working diligently with the state and with our federal partners to be able to access any type of reimbursement we possibly can as quickly as we can.
thank you.
Okay, well, I think we probably need to move on with this item now. So Kim, it seems like you got what you need. I also am supportive of moving forward with communicating to the state what the regional needs are and putting in that request, and certainly the state understanding that the county cannot front the money.
Great,
Okay.
Thank you so much. I appreciate all of your time. Thanks.
All right, super, thank you. Let's see, back to Marie. And so Marie, I think to finish off this item, what we need to do is discuss the proclamation, correct?
Hi, thank you so much, Madam Chair. So yes, there is a proclamation in terms of how we move forward with operations, and I'm not sure. So I mean, I have thoughts in terms of based on the science and the information and data that I shared in terms of our testing. Again, we don't have the Saturday testing blitz information, but I'm not sure what it is the board wants from me in terms of the proclamation discussion, Madam Chair. So I stand available to answer questions.
Okay, super. Well, I just think that's probably what we need to do next.
Okay.
And so, hold on just 1 minute. I think, let me just go back to the alternative care site. I didn't hear from Supervisor Parks. I was just assuming that that was agreement, but let me just double back and see. Let me just make sure. Supervisor Parks, did you have anything you wanted to add to the alternative care site discussion?
No, Madam Chair, as long as we don't step into a situation that we have ourselves in right now with Aspen Hotel, I'm fine with going on and getting some research done with the state on what they can do to help us out.
Okay, super. Thank you so much. I appreciate that. I didn't want to didn't want to leave you out, so I apologize for that. So thank you very much. Okay, so we're done with that item. And so now how about, so Dr. Peoples, no, I just think just being available to answer any questions about the proclamation. I mean, obviously it's an opportunity to continue to remind the residents of Coconino County and the visitors of Coconino County that we need to remain vigilant in our approach. We need to continue to do social distancing. We need to continue to do the hand washing. I mean, all the information that's been coming out of our public health services area, as well as the CDC, et cetera. And so we see that our numbers continue to increase. I mean, there might be other areas of the state where that is not the case. However, in Coconino County, we do see an increase in our numbers, and we do not see over a 14-day period a significant decrease. And certainly our neighbors, our brothers and sisters within Coconino County who are also on the Navajo Nation, we continue to see an alarming increase there, and we want to make sure and acknowledge that, and we certainly look forward to the day that those numbers are decreasing. In the meantime, I mean, we are all of us are in this together, and so we want to make sure that the public understands that Coconino County continues to not only be mindful, but to be implementing prevention measures. So with that, members of the board, I think basically what we need to do is just discuss, or at least get some type of indication if you would like to issue the proclamation restricting the use of certain public establishments, if you'd like to reissue and extend that proclamation.
Madam Chair.
Yes, go ahead.
Trying to, I'm looking at the now therefore I'm hoping I have the most updated. I'm starting to lose track of all these things. But mine's dated 5/5/2020. Is that the most updated, or has it been modified again?
That should be the most
That's
updated.
today. Yeah, that's today, but okay. And then as I was reading the now therefore, so we're putting restrictions on, but the governor plans to open them up. And I'm not sure I see where, we I guess conform to the governor's piece related to that, since we're still under that emergency. And then I was looking for the statement associated with how far we continue this, creating an adaptive date associated with that. And so it's probably more of a question to Rose where they're embedded in this document.
Okay.
Chair Archuleta, Supervisor Ryan, can you
Sure.
hear me okay?
We
Sure.
can. Thank you,
Yes.
Rose.
Okay, well, so first to address Supervisor Ryan's first question, at least at the last time I reviewed this, we did not have the new information from the governor's office in terms of what his intent was going forward. I think this, was put together so that the board had this to review and the ability to make decisions from there. Certainly, it can be changed if the board's desire is to model the changes that the governor has made to his executive order, meaning the opening of hair salons and such on May 8th, and the opening of dine-in restaurants as of May 11th, with the caveat to both of them that they implement social distancing guidelines and other measures. So I think that I imagined that would be part of the discussion today, was how far the board wanted to go, whether it wanted, whether it found the governor's openings to be appropriate for Coconino County, given Coconino County's situation. I think that, without going into too much detail, at least at the moment, the board could discuss whether there's interest or sufficient concern here to potentially be more protective or more restrictive than what the governor is doing. There are obviously potential legal issues with that that I'm prepared to discuss, though I think the better place to do that would be an executive session. But if the board's interest is to conform to the governor's order, then that's certainly a change we can make to the proclamation in front of you, simply as you discuss and as you all indicate, where your support is. Mm-hmm.
So just quickly on that, aren't we still under the governor's order?
Well, the governor's order is still in place, but so is the county's order. The county declared a local emergency as well. While our prior proclamation expired, our declaration of emergency is still in effect. And so that allows the county to make orders out of that local emergency. There, I think, is a discussion to be had about whether the county or any local jurisdiction has the authority to, there's never the authority to make conflicting orders, but there is potentially the authority to make more restrictive, more protective of the public health orders. And so if the board were inclined to do that, to want to implement something that continued more strict restrictions that were more protective of public health, then that would be a discussion for, we can have that discussion on legal authority. But that would be what we were acting under now, is the fact that there is still the county still has an active declaration of a local emergency, and the statute provides that pursuant to that declaration, the county can issue proclamations and orders, including the closures of certain businesses, in order to, mitigate that emergency. And to the extent, well, again, without going into too much detail, I think that there's a place for discussion on whether the county has authority to enact a proclamation that is more restrictive than what the governor has done.
Madam Chair, on that one, I would wait to hear a little bit from the board, but be willing to go to executive session if we needed to. But just to follow up quickly on my second question.
And I did want to maybe direct, I know that Joanne also helped with this agenda item and provided input. So I know that she's also prepared to speak to this as well. Supervisor Ryan, if you would like.
Sure, and a piece of this are recommendations from the health department also on this. So I don't want to belabor it, but it seems like we do need to pause for a second and take a look at some of these. So if Joanne had additional comments on this, or Marie, I'd be willing to go there.
Okay.
understand time's short too.
Yes, understood. Okay. Joanne, did you want to add anything?
Madam Chair, members of the board, and County Manager Jane, when this item was added to the agenda last week, this was after the governor had his press conference where he loosened some restrictions specifically on retail. The discussion at that time, we were getting quite a few calls, about confusion about what was occurring locally. The proclamation that the board had previously adopted, it expired on April 1st. So the idea was to extend the proclamation until further notice, and that's the date that's in there currently, to ensure that if there was an opportunity for local authority, we were also getting a sense from the governor's press conference last week that he was going to be looking to the locals for, this type of authority, that we would be ready to go. So that was the thought behind this proclamation. As Rose mentioned, things changed yesterday after the governor's press conference, where he is loosening restrictions on salons and barbershops, and then next week on dine-in restaurants. I think the thought locally is that, we are not seeing the 14-day decline that the governor mentioned yesterday in the press conference. And whether the board wanted to make some kind of a statement, and whether it's through proclamation or other means, to ensure that, our establishments and then our visitors to our establishments would continue to follow the CDC guidelines and recommendations from our county health department.
So just quickly on that, I mean, we listened to the EPI presentation. There are the recommendations to follow that trend. Trend down if there were to be modifications on that. We do have a pandemic. We don't have a vaccine. We don't have appropriate testing yet. And so I'm open for the discussion with the board on this, on what direction, and also, recommendations from the health department related to that. Just quickly on the until further notice, I'm not reading it in the document. Maybe where is that in the document?
Madam Chair,
this would be applicable, right, till further notice.
Correct, effective immediately May 5th and until further notice. It's under item 2.
Item 2. Oh, there you go. The piece that's underlined up there. I'm looking for it all at the end of this, as the therefore at that point. Okay, got it. Underlined. Didn't. Thank you on that. Madam Chair, got the rest of the board to go through, so I'll stop at this.
Okay, thank you very much. Other members of the board, do you have questions on this item? And just take yourself off of mute if you have questions. Supervisor Parks, it looks like you're off of mute.
Thank you, Madam Chair. I do have a couple of questions. One is about our curve and the numbers of positives that we are seeing that don't seem to flatten with the overall Arizona 14-day forecast. Are those numbers because we are absorbing folks from Navajo Nation? Is that the reason that we are not flattening our part of the curve or our curve? Do we have greater numbers because of our proximity to Navajo Nation and our willingness and ability to absorb the sick folks from Navajo Nation? I'm wondering about that because if that's the case, Navajo Nation is taking care of itself, and they have some very strict rules up there. You can't even go into a store or any place else up there without a face mask. Much more restrictive than the rest of the county. So I'm wondering if our willingness to make more restrictive proclamation here in the county is maybe skewed by our Navajo Nation numbers.
Marie, did you want to add to that question?
Yeah, I would like to. Thank you so much. So the numbers aren't skewed. And I will share that because, again, with the disease investigation, if someone lives in Coconino County, regardless if it is part of Navajo Nation or not, if they are a Coconino County resident, they are counted within our numbers. If they are not a Coconino County resident, then we are teasing those out and returning them to the proper jurisdiction. So we're not necessarily absorbing, and I appreciate the question. These are complicated discussions, but we're not absorbing or adding an over or under in terms of proximity and where people are located. The fact is that we have, we're a border community in many ways, whether we're talking about the nation or even some of our folks on the Utah border. We've really been closely monitoring that as well because there hasn't been a lot of testing coming out. But the numbers that we see are Coconino County numbers to the best of our ability to tell. We continue to work with Arizona Department of Health Services to true up the numbers and to make sure what we're getting is correct. And so there's been a couple of fluctuations that we've shared when that has occurred. I think a large part of that, to get to Supervisor Park's question, is that we know that there are clusters within certain populations and certainly within the nation. Those clusters do impact us as people travel back and forth and have family in both locations, and in some cases perhaps even have residences in both locations. So it is difficult at times, again, to be able to true that up and to tease it out. But what that shares, again, is that we have community transmission. And so it really means that we're keeping an eye on our community numbers. We also know that we have a lot of visitors, and that's something that always impacts us regardless of what we're talking about. But we have a lot of people recreating and visiting, and it is difficult to tell in terms of transmission if it's visitors passing through. Even as we return those numbers to their appropriate jurisdictions, it still impacts our community, which is why things like the Grand Canyon being closed has been so important to our community being able to flatten the curve. As I shared a little bit earlier when I talked about the testing blitz, we are really concerned with the uptick of people recreating and enjoying our beautiful community as we try to flatten the curve. That's going to be an uphill battle for us to try to prepare and fight. And so again, I appreciate being included in this discussion as we talk about the proclamation and how we might move forward. But from purely a public health perspective, we are not seeing a decline in our cases to be able to talk about safely opening. And I know there's many other factors that go into that in terms of our surrounding communities and what the state of Arizona is reporting as a whole. I would caution for us not to necessarily look too much to the state of Arizona numbers at this point in time, because again, the testing blitz numbers from across the state have not been reported. I am hoping that ADHS will start releasing some of those numbers because that is going to be the indicator. Thank you, Madam Chair.
Others on the board who wish to discuss this item? Supervisor Babbitt?
Madam Chair? Yeah, thanks. So, I just think this is not kind of ready for us today. There's no enunciation of the most recent piece here. There's no, we have not had a conversation in e-session on liabilities, what are authorities, given the hierarchy of emergency declarations. And so, this is not, to me, it's not ready for us to contemplate it. I think there's, as our attorney pointed out, there's a whole ton of issues that even if we want to contemplate it, need to get worked out. So I understand on why, as this trajectory moves, much of it out of our authority and control, I think it's very important we try to insert and inject common sense, information-based strategies, many that are put out by CDC. But this is not an up-to-date document. It is not reflecting the latest executive orders, which are absolutely part and parcel of what our original declaration was. So I don't think this is ready for us to do anything on it today, personally.
Other members of the board?
Madam Chair,
Yes, go ahead, Supervisor Parks.
I think that Supervisor Babbitt is correct. I don't think that this is something that we should take on today. I think that we need to get some more information on it. I think that this proclamation should be postponed till a later time.
Okay, well, thank you all for that. I will say that this, obviously yesterday with the governor's announcement, this material had already been prepared. And so certainly the landscape has changed because of the announcement yesterday. And frankly, I found out maybe 25 minutes before the governor was going to have a press conference, there was a notice that went out regarding that from his office and from our County Supervisors Association. So that certainly, I think, caught everybody by surprise. I do think, though, we need to make a strong statement as the Board of Supervisors regarding the fact that it is not a one-size-fits-all for the state of Arizona regarding the experiences with COVID in various communities. I mean, certainly in Coconino County, we see the numbers and the data, and there is not a demonstration of a lowering of numbers. I do understand, as an arm of the state, we are under the governor's executive order, as is other communities, and certainly we can have a discussion in an executive session about what our power and authority is in terms of being able to do something different. But at this particular time, I certainly understand that this may not be ready to move forward, but I would like to see us make a statement to our community and to the residents that we need to continue to be vigilant, that obviously there is a loosening through the executive order of some of the regulations. However, what we're seeing in Coconino County with our numbers, would likely not support that executive order, just because our numbers are not showing the 14-day decline. And I know that in the overall state, what the governor discussed yesterday and what he showed on his slides is that they can see a decline. However, that is not mirrored here in our county. So certainly we can bring this back, and we can even schedule it for an executive session next week if that's the pleasure of the board. But I would like to at least get your feedback about making sure that we are clear in our communication to our residents about the need to continue to be cautious and to practice the CDC guidelines and the guidelines from our public health department, because we are not in the clear.
Madam Chair, if I may.
Yes. Go ahead, Supervisor Ryan, and then Vice Chair Feller.
Okay. Just quickly, and Lena didn't have a chance to talk either, so, but just some thoughts on it. I think the governor's piece, the timing's going to unlock pretty soon here, so we might want to contemplate sooner than later. I do feel that we need to have this discussion in executive session, and maybe it's taking a break and coming back later. The only other piece would be, when does our last one was not until further notice. That expires at some point. I don't have that right in front of me, but somebody that's been reading every detail probably knows that a little bit better. But that's a key piece that we want to focus on also.
Madam Chair, it expired April 1st. The proclamation.
Right, so right now we don't have a proclamation because our last one expired April 1st.
And then again, this fits into, we probably need to figure this out sooner than later here.
Mm-hmm. Absolutely. So we could have a special session as well, or we could move this to the end of our agenda today as well, to see if we could squeeze in then some additional time to speak to this item. Vice Chair Fowler?
Yes, Madam Chair, thank you. I'm actually hoping that we make a decision today. That's what I was hoping, because we have our Facebook Live that we're going to be doing also. We need to give direction to our residents and let them know where we stand and what we see and the reason why we take a position. So I'd like to address this today, like you said, maybe at the end of our agenda today. Thank you.
Okay, well, thank you. I mean, we can do that. We are noticed for that, I believe, and I'll just confirm that with Rose. Rose, can you weigh in on that?
Yeah, one, I would say certainly we can move the item itself to the afternoon, and because we have general language regarding the ability of the board to go into executive session on any item on the agenda, we can, for legal advice specifically, we can move this item until the afternoon and have an exec session if that is the board's wish.
Okay, super. Well, I am hearing that there are at least 3 members of the board that would like to do that. So we will go ahead and do that for later this afternoon so that we can go into an executive session. I know we're falling behind on our meeting right now, so I'll go ahead and move us now to item number 13. And we have it's discussion and possible direction regarding the continuation of active contracts for services and goods related to COVID-19 pandemic, including but not limited to contracts associated with the use of the Aspen Motel as an isolation and quarantine facility. And we did receive some information on this earlier because it is related to item number 12, which was the COVID update. And so, Marie, do you have any additional information you would like to share? And if not, we can just go into a discussion.
Thank you. So I'll be brief in the interest of time. As we heard from Dr. Mujan today, just as a recap, NAH has been a great partner with us, especially at the testing sites by providing the providers for most of the time, but they're unable to contribute financially to the isolation and quarantine hotels for their own financial and business purposes. But we did hear from Dr. Mujan that NAH believes that this is a valuable resource. We heard from Flo Spiro on some separate conversations that she would like to see the operation continue at least for 30 days as we really see what is coming our way. So I wanted to share that information. You also heard from Ms. Musselman some of the DEMA and FEMA updates in terms of us being able to submit for reimbursements coming up, and we still don't know exactly what those reimbursements will look like, but now that process is underway where we can at least submit our expenses and see what the return response is. So that's a good guidepost as well in terms of knowing, hopefully in short order, where we stand financially. We also have seen the data that we're not seeing a decline in the trend and that we're seeing more positives at Aspen Hotel. Lastly, just to recap that thanks to some of our logistics team, the biohazard cleaning contract has been able to be reduced. And so I would just, offer those different points as items to contribute to the discussion. And again, I thank you, Madam Chair and members of the board.
Mm-hmm. So just to be clear, Marie, in terms of some of the cleaning and the security, et cetera, what is the anticipated decrease? I mean, is it like 50%, or do we have an actual dollar amount? Or
we do have an actual dollar amount, and I'll try to pull those up. I apologize. I sent them last week, but I don't know that I have them in front of me. What they did is they reduced the cleaning fee, or they took the cleaning fee all the way away. They had a cleaning of their equipment fee after doing the room. So they have removed that in its entirety, and they have reduced the fee significantly for non-COVID positive rooms. We did just have one price for regardless if the person staying in the room was COVID positive or negative. So the fee for the COVID positive room cleaning has stayed the same, but again, for the negative rooms, that price has been reduced significantly. So we will see quite a bit of a decrease in the cost. And then our logistics team is going on site to monitor and make sure of the room cleaning, which there hadn't been any concerns with the room cleaning, but to direct that cleaning crew that know this is a positive room, this is a negative room, and also to try to monitor the times for cleaning rooms as well and try to reduce that time from the average of 2 hours. Regarding security, and thank you, Chair Archuleta, you've prompted me thinking about some additional things. At the request of NAH, particularly Ms. Spiro and Dr. Mujin, when we initially had these conversations about them partnering financially with us, they asked to review all of our contracts in hopes that they could perhaps help us lower the contracts. We did hear back from them on that. They felt like the security cost was in line with what they were paying. It was about $12 more an hour, but they felt like that was appropriate considering the risk to COVID and was in line with what they would see as well. The cleaning cost they did feel like was overly high, and with their assistance and feedback, that is part of what helped us lower those costs. And then the other contracts they felt like were all in line with what we were paying. So we've been fully transparent with our partners in terms of what those costs were and trying to piggyback if possible on other contracts. As it relates to the security contract, I can provide an update. We have not been able to lower those costs. Again, they are reasonable and in line with what would be expected. So it will not go down at Aspen, but we were able to work with NAH, who was requiring us to have security there while their providers were there on those sites. We did have some conversations follow up through email with Dr. Mujin yesterday. He felt that now that operations had been going, that they could waive that requirement and that we would no longer have to have security on site at the testing sites. That will reduce our security contract by a lot. So for the rest of this week, we have went down to 1 security officer instead of 2. And starting next week on Monday, we will not have security there. We're able to backfill that with some of our National Guard support and other staff now that it's no longer a requirement. So while that doesn't directly relate to the Aspen contract, it does help in terms of overall lowering cost for these operations. Thank you, Madam Chair.
Sure, thank you. And if we were to go to another property, explore other properties, then those charges would remain, the security charges and the biohazard and the cleaning fees, that would remain?
They would all remain. The only thing that we can influence in terms of costs would be having a cheaper property to be at. We would still be required to do the biohazard cleaning. None of the properties that responded to us were willing to absorb that, which is reasonable. We didn't anticipate they would. And security would be required as well at those properties, which again is reasonable. We didn't expect anybody would waive it, but we did ask the question.
Okay, thank you. So what is the pleasure of the board? I mean, this discussion is about obviously Hotel Aspen. We did get some input from Dr. Mojin from Northern Arizona Healthcare, also with FMC. And so, and we did get a series of reports from Marie regarding the conversations and also some of the research that has been done on this issue. And so which way would the board like to go?
Madam Chair?
Yes, go ahead, Supervisor Babbitt.
I'll start out. So appreciate some of the updates. I was really glad to have that presentation this morning with FMC here. I think, I have been at the place for quite some time that this burn rate of money is just not in sync with our utilization. We have bought a giant facility for modest piece that's costing us, north of 10,000 a day, regardless of whether zero's in or one's in. So we've got to change course, and I appreciate the conversation that had with the operator. But we have to adjust here, and it's not about the population we are serving or the need. It is about right sizing it to fit the utilization. So, I want to go back just to a couple pieces. So what we heard today was that a large number, historically, it's been a majority of folks who get referred to are there just waiting test results. And Dr. Peoples mentioned that is a higher number today. We've seen some of this trends, but the reality is it's still a large number who are there just in waiting. We have a vehicle in the rapid test with adequate testing, given that only 0 to 3 people are a typical range that gets referred here. Think of the benefit if we could very quickly and adeptly understand whether they were positive or negative, not having to get them into a facility, regardless whether it's Aspen or anywhere else. This is the perfect, from an operational perspective, the perfect utilization of a rapid test piece. I think nursing homes are another great one. The reality is there are very few people getting referred out of FMC to this. I would really hope we could do that to pare this down so we don't, so we get people's results very quickly, as opposed to housing them if they don't need to be housed. We want the people who need to be housed there, unquestionably. And so I am very comfortable with moving forward to put the notice on this contract and parallel. So the question for me also is then what is the parallel conversation that has been going on that should continue to go on? And I want to just, circle back to 2 things I have not gotten an answer on. Is CARES 2 funding, is there an opportunity for the CARES funding to for real property acquisition and reimbursement? The amount of money we are spending, we could buy a facility. We know this is going to have some need for this for the next year. The amount of money we are spending, we could look at buying a facility. I would still like to know if CARES has an opportunity, an option for reimbursement for real property acquisition, that if we purchase something, we could then turn it over at the appropriate time down the road. It would be an asset that we would have. Secondly, I will continue to go back that we should be engaged in conversations and discussions with our partners who do this work for a living. Yes, this is a medical piece, but this is also a population sheltering piece. I can't stress enough how much I think we should be working with Flagstaff Shelter Services, with Catholic Charities, some of the other NGO world, to come up to a win, mutually supportive and mutually aligned strategy on this. Whether it is testing, whether it is continuum of care for housing insecure people, we should be aligned and in partnership here. And so as we look forward, if it's the desire of the majority of the board to go, I would really like us to focus on productive conversations that relate to that capacity, because as we know, the city of Flagstaff brought resources out of CDBG for 60 to 70 rooms that has done really important work. Flagstaff Shelter Services is engaged in active testing with their partners. We should be part of this larger effort because there's just so much alignment. There is some difference, obviously, and that is some of the medical pieces here, but that's where I'd like to see us go, and appreciate the conversation. Still would like to get the answer back on the real property out of CARES. So thank you.
Great, thank you. And we'll see if there's an answer on the real property right now. If not, we'll work to get that answer. But Supervisor Webb, can I ask you just a little bit more? Can I delve into a little bit more detail in terms of what your vision is in terms of working with our existing partners in the various shelters, whether that be Flagstaff Shelter Services or Catholic Charities or any of the other shelters? Like what is your vision in terms of working with them? I know we're currently working with them, so I'm just trying to dig a little deeper. Like, what is it that you are envisioning?
Well, they currently have their facility. We have ours. We get referrals one way from there after they find someone with a positive. So here's my vision: is we're serving a very, very similar population. The difference is whether they are testing positive or whether they are self-isolation testing, awaiting test results. It is a population that we should be coordinated on and not siloed on in terms of facilities. So for example, if we went to a 40-bed facility, facility, and we needed a block of 20 beds that for our rotating people in after rapid testing, the only people who are really going in there are positive people, or at least maybe a little bit more focused on that, then we could also bring that extra capacity for sheltering needs so that the shelter has the space to do what they're currently doing, which is managing their population so they don't have 170 people sleeping head to head, toe to toe in that place. They're doing a really impressive job with help from the city to spreading out their population to help manage and mitigate. So that's the kind of thing, like much more of a shared partnership, much more of a shared facility, still has a component of the medical side of things from referral, but also is a more collaborative piece. That's kind of where I'm thinking.
Great. Well, let me ask Marie. Can you comment on this in terms of the actual purchase of real property, and then also the collaboration with the shelters within Coconino County?
Thank you, Madam Chair. I'd be happy to. So I apologize, I cannot answer in terms of real property. I would look to our CARES team, and I've read the DEMA guidances and FEMA guidances that we've received, and I have not seen anything about purchasing a property, but that does not mean that there's not other opportunities via CARES. So we'll continue to dig into that, or perhaps one of those members has an answer now, I'm not sure. Regarding partnering, absolutely. It is our goal to partner. So there's, as everybody knows, with COVID, the landscape has been fluid and it has evolved rapidly. So when we began this process and when we stood up the hotel, the guidance was for individuals that were housing insecure and awaiting COVID testing or were positive for COVID testing. And that really limited our partnership with some of the shelters because we were following our guidance because of course, as a county, we needed to be reimbursed. So we were partnering with them, but we were partnering with that limited space of people testing or already having a positive. During some of that time, Flag Shelter Services with the city and perhaps in partnership with others as well, and we were part of the conversations, they embarked on their operations to house, as Supervisor Babbitt shared, a slightly different population, but with a lot of overlap. So they did secure some hotel services. Since that time, the guidance has opened up so that we can house housing insecure people that are not undergoing COVID testing, but are simply at medical risk. And so that has opened it up. And so unfortunately, those two parallel tracks were already down the path prior to the guidance catching up with what each entity was doing at that time. We have since reached out to Flagstaff Shelter Services, asking if there is a way to partner and to combine into one service. On some of the city-county calls, there's been those discussions as well. I'm still awaiting a response from Flagstaff Shelter Services on what would it look like if we could either have a room block from them, or perhaps they had a room block from us to do exactly what Supervisor Babbitt was describing, to really partner and to have one common location. So that conversation is underway, but again, have not received responses. But we do continue to take their referrals, and there have not been many, but when they do identify someone as being COVID positive, that is when Flagstaff Shelter Services has referred someone to us, and we do take them. We are partnering with Catholic Charities almost every day in terms of finding space for their individuals, and we have never said no. So some of the most recent conversations with Catholic Charities, and I don't want to name hotel properties, but through Catholic Charities, through Flagstaff Shelter Services, their fee is running $80, $90 a night. And what they are needing to pay is around $45 a night. So we have been taking the folks that they're referring to us just because we do have additional rooms. And now that we are open to those populations, we can do so. So there's a lot of room for opportunity here. Perhaps what might be incredibly beneficial is if there were a roundtable discussion with all of those partners. Everybody, is my sense, is incredibly invested. We're just all doing different things and maintaining our operations. So rather than one-off phone calls or emails, perhaps the board could help being a convening partner with our city partners, Flag Shelter Services and us, and perhaps we could just have a roundtable discussion and see how we could streamline services. Thank you, Madam Chair.
Thank you, Marie. Joanne, I'm going to just go ahead and ask you, do you, and looking at the CARES Act, is there any, do you know if there's any information on real property? And if not, then would you be able to get us that information?
Madam Chair, I believe Eric is on as well. And as you know, we're co-leading the COVID task force. I am not, I don't have an answer to that question. I'm not sure if Eric does, but we'd be happy to look into that. We do have our next meeting on Thursday morning of the task force, but we can look into that prior to that conversation.
Okay, super. Thank you. Eric,
Okay.
any
And Eric's, I think
information?
Eric's jumping in.
Hi, Madam Chairwoman and members. We will definitely look at it. Treasury just did issue new guidance. I haven't had a chance to look at some of those, but in general, it was costs not budgeted for, not considered, that are directly relational to the COVID-19 response. So again, needs much more research, and I only play a lawyer every so often, not being one, but I think there's a way, an argument that can be made in that regard.
Great. Well, thank you. Appreciate you taking a look at that. And that way we can get that question answered. Okay. Other members of the board?
I'll go ahead and weigh in, Liz.
Sure,
Yes,
go
Matt.
ahead, Supervisor Rand.
So in terms of, first and foremost, with the contract that we have right now, as Art noted, facility is much larger than what we need with the current populations that we're looking at. Again, we will need to deal with the population, particularly related to the COVID-19, for a prolonged period of time. By giving notice, as I understand the contract, is that we're committed for another 30 days for those costs, which gives us 30 days to see if we can work out a different model related to that. And so I'm willing to move in that direction. Really appreciate the proprietor's cooperation with us when we didn't know how this would impact us. We needed to set something up rapidly, and we did. And having that ability was very important as we wandered through the changes of just how this epidemic influenced our community. But now that we've had a chance to pause and say, okay, let's look at a different model. This is too big. It is costing us quite a bit of money. Hopefully we get reimbursement. We'll wait and see, and that's delayed. But we can't continue in the direction we're going. It's not a not a good business operational component, and we have other populations that we have to look to in the future, as well as our own commitments to the county, running courts, jails, etc. We have, which could have expanded populations and greater needs. So we just need to be fiscally frugal as we take a look at it. To step into the partnership conversation, it's always worth having that conversation. Does it fit where we need to go? We also need to be cautious of stepping into an area that we don't normally service, and do we have the capability of servicing, and yet we need to look at our broader community. So long discussion just to swing back around to, I think we really need to give notice. I'm willing to go in that direction. That means for staff that we need to figure out a new model and where we step into. And more specifically, the key piece is addressing the insecure population as it relates to COVID-19. And then there are other opportunities or discussions to have as it relates to populations that don't quite fit that, but have the potential of being covered. Thank you, Madam Chair.
Thank you. Other members of the board? Supervisor Parks or Vice Chair Fowler, did you want to weigh in on this one?
Madam Chair, this is Supervisor Fowler.
Yes, go ahead.
Thank you. I appreciate the presentations and just the work that our staff has done just to get us to this point and being able to really trying to work with all the partners and healthcare providers. It's such a complex issue, but I just want to make sure that we have another place to go to, because these individuals, where are they going to go if we just give notice and we still don't have another place that we can say that is going to be the facility. So I want to just take caution on that. And yes, we're paying a lot and hopefully we get reimbursed, but I want to be on a more of a cautious side where we make sure that there is another place to move to and that these individuals will be cared for. So I'm there right now. So thank you.
Mm-hmm. Thank you. Supervisor Parks?
Thank you, Madam Chair. I do feel and have felt all along that we're wasting quite a lot of money with Aspen Hotel. Even at the Aspen Hotel's lowered cost, it's still $170,000 a month. What I heard this morning, there are other hotels in town that possibly would be as low as $42,000 a month. And that is appealing. I think that what we need to do with Hotel Aspen is to abandon that contract. Because the hotel owner has indicated that he can't go very much lower than $170,000 a month. And if he could not get that amount, he would shut the hotel down because it would be cheaper for him. If we abandon his contract, that would allow him to go ahead and shut down, and it would be cheaper for him. And this town is full of hotels. I don't think that we are going to not find a place to put people. If we can do it for less money, then I think that that's what we need to do. If we can not waste 100 rooms a night at another hotel, if we can get a smaller hotel with providing 20 rooms a night instead of 123, that would be quite a bit better, I think. If we can do as Supervisor Babbitt suggested, partner with Flagstaff Shelter Services and get a partnership that would make it more reasonably priced for us, that would be fantastic. It'd probably work out better for Flagstaff Shelter Services as well. As far as acquisition of real property to solve our problem, I have been advocating for that ever since we began this. We could save the money that we're pouring into the rental of Aspen Hotel, and in several months' time we could buy a hotel. And yes, I know that that hotel was on the auction block, or it was for sale before this COVID-19 started for $13 million. But I will lay odds that there are quite a few hotels that are not going to be anywhere near that expensive that we could acquire. So anyway, that's where I'm at. Thank you.
Well, thank you very much. We appreciate the feedback, and so I'll be the last here to weigh in. I think we're at a point where we're ready to exercise the 30-day clause in the contract, which would be an intent to terminate the contract within those 30 days. And here in the very near future, we already have the staff that has done the research on potential alternatives. In my perspective in terms of exercising 30-day clauses, I just want to explain my perspective. It's not that I'm hearing this from any of you, but my perspective is that this would be a signal to go and find an alternative to the current property that we're in, which is a large property. I want to acknowledge that this particular property owner in this hotel was the only property owner and hotel that was willing to enter this endeavor with us. So I appreciate, you know, his willingness to do that, the courage to do that, and want to thank and appreciate that, understanding that it is a large property and the overhead is great there. We need to probably move to some alternatives, whether that be a smaller property or whether that be exploring the ability to purchase a property, but that we consider alternatives. The 30 days will give us a couple of weeks to determine what those options are, and for this board to provide direction on proceeding with one of the options. That way it would be seamless. We do need to have a transition. We can't be without a location, and also to continue our partnership with the various shelters within Coconino County and continue to explore more opportunities with them is also something that we can continue to do, but knowing that we already are working with them, but certainly now with this, what I'm hearing is direction from the board to exercise the 30-day option. I mean, certainly communicating with the shelters about that, communicating with the medical providers that do refer people to the hotel, which includes Northern Arizona Healthcare, as well as Banner Health and Page, and the shelters who have the ability to refer people, to renew that communication regarding the board's direction and seeing what might be a viable community solution. So that's what I'm hearing, and if there's no other comment, then that is the direction that we will give to staff. Okay, hearing no other comment, then that is the direction. Jimmy and Marie, is there anything else you need from us in this regard?
Madam Chair, this is Kim Musselman. Marie had to step away. I think we have what we need. Thank you.
Okay, and Jimmy is nodding yes.
Thank you, Madam Chair and members of the board. We do have direction and we will follow up with you accordingly.
Okay, great. Well, thank you. I mean, obviously we are, that's the items that we had prior to a break for lunch. We are off schedule. So would the board be okay with just having an hour for lunch so that we would reconvene at, instead of, that we would modify our time and we would reconvene, let's say at 2 o'clock? Would that work for every board member?
Yep.
Okay, super. Then we will do that. We will
Yes.
Yes, we will reconvene at 2 o'clock.
Thank you.
All right. Thanks so much. Appreciate the morning. Thank you. Helping us with our schedule this afternoon, we do have a presentation and discussion regarding the upcoming fiscal year 2021 budget, and continuing our conversation as a board on the fiscal year 21 budget, accounting for the impacts of COVID-19, while continuing to provide services to the residents of the county. And so I'm going to turn this over to County Manager Jane to introduce the item, and then we will have other presenters. And I just want to make it known that I do see that all of the supervisors are on. I'm just checking. So let's just go through just a quick roll call. Supervisor Ryan.
Right here. Thanks.
Supervisor Babbitt.
Present.
Supervisor Parks. Who may need to unmute. Let's see, Supervisor Parks, are you on? Okay, we'll get him on shortly then. Vice Chair Fowler. Okay, well, we do have 3 members of the board, and I will ask our clerk of the board to check in on the other supervisors. They may be running just a little bit late. I know we've had a change of schedule today, so we will check in with them, and when they get on, I will recognize that they are on. But being that we do have a quorum of the board present, why don't we go ahead and proceed? So, Mr. Jane.
Thank you, Madam Chair, members of the board. Good afternoon, and good afternoon to our to county leadership and others participating in this meeting today. I do appreciate the opportunity and the space to continue our budget discussion this afternoon. As we recall, this discussion does follow a series of presentations to the board on the county budget for FY20 and 21, as we were developing and seeing trends in 20 and then seeing what it looked like for potential options in 21. And as I mentioned last week, today looks a little different than where we were a few months ago. In fact, it seems that every day there are new variables that we must consider in our budget discussions. We do continue to work with our partners during these uncertain times to better understand the impacts they are considering. I specifically have heard and passed on information to the budget team from additional information from the city manager of Flagstaff and Sedona, and I do appreciate the input and the feedback from those communities on top of the feedback we'd already received previously. One of our main challenges continues to be that we have not received state shared revenue numbers for the month of March, as we've discussed. It is difficult without this information to predict, kind of true impacts of the COVID-19 pandemic, and that is obviously not unique to Coconino County. We are hoping that we are going to receive county sales tax and state shared revenue numbers, hopefully by Monday the 11th. So that's our hope. During this challenging time, we do have some good news. One that I did announce recently, but 2 weeks ago, we did hire Siri Mullaney as the county's new finance director. Siri is not new to the county, as you all know. Siri served as the budget manager during the Great Recession. Siri's work to assist the county, help the county manage through this difficult time was really part of the key, one of the key factors in the county's ability to weather the recession. And her knowledge of our 10-year plan and the recessionary models that we have used previously and are looking at using currently. Since leaving the county in 2011, Siri has stayed in the community as serving as both the Dean of Finance and Accounting at Coconino Community College and as the Director of NAU's Budget Office. We could not be happier to have Siri back on the team. She's already jumped in to offer her experience, her expertise, and her feedback. I have asked her to share a few thoughts with all of you today, including her current perspective on the budget and the 10-year plan. So, Madam Chair, members of the board, I'd like to welcome Siri Mullaney and ask her to share a few words with all of you.
Great, welcome Siri, and go ahead.
Great, thank you, Madam Chair, members of the board. So I do, first of all, want to thank County Manager Jane and the rest of the budget team for including me in their discussion as follow-up to your last meeting. As a result of that, I did have some observations coming into today that I did want to share. The first thing is, and I don't think it can be said enough, but the history of financial planning that the county has implemented has really positioned the county to respond to the current situation much better than they could have under normal circumstances without that appropriate planning. So I think that's the positive in all of this. Yes, there's a lot of uncertainty and a lot of unknowns, but there is also, planning efforts that have led up to this point that really add some tools that the county might not otherwise have in the form of emergency reserve balances. So a couple things as I look at what is being presented, the conservative 10-year scenario the board has requested, I think, that feels like a very much a continuation of the financial planning efforts. And I think it's the appropriate step to take to be looking at things in the long term. It's also, though, of course, important to be looking at short term and really balancing the short term solutions and the short term outlook with that long term picture. So some things on the short term also that I noticed is that the team really has done a great job of recommending some short term strategies to deal with what is currently going on. Normally as you're looking at the longer term outlook, you would say that the further you go down the road, the more uncertainty there is. But in these unprecedented times, of course, there's a lot of uncertainty right now as well, and even in that short-term outlook. But they're really implementing the right tools by, doing a deeper analysis on hires, trying to find vacancy savings, really paring down the increases that are being recommended to the board, and really going with only those that are very much essential, and delaying, not necessarily unnecessary, but delaying things that can be delayed, like capital purchases in one time. So all of these are very good strategies that are being put into place in the budget that's ahead of you. They are presenting a balanced short-term budget for FY21 going into FY22 based on the current assumptions. And again, there's a lot of uncertainty in those. So only time is going to tell, unfortunately, on some of these things, whether, it's the right mix of revenue assumptions and that if these strategies will address everything, but it's definitely a well thought out start. We have seen in the past when the state has had issues with their budget that there have been, shifting mandates or, even more significant declines in state shared revenues. And those are just really hard to, tackle until they're more known. And right now, we're working with the assumptions we have. So I think they've done a good job. And then knowing that they're also preserving that reserve, that emergency fund that has been built up, so that if one of those things comes forward during the year, again, it just allows the board and management to have a little more time to do appropriate planning, to put in, more thorough thought through, well-vetted solutions versus reactionary, emergency type situations. So again, that's really the good news on the short term and with what the county has done. On the long-term side, of course, again, we're using a very conservative long-term outlook, and we're not going to solve that today, nor really should we, because again, there's tons of unknowns in that scenario. It's one scenario with so many variables that could change, and really more information is needed to know, is there a sustained structural deficit, or is this more of a short-term significant decline, somewhere in between? We're not totally sure, but if we get to that long-term scenario, I will say the short-term tools may not be as appropriate in balancing a long-term. So what staff has brought to you is really a well thought out plan for keeping you informed, continuing for the county manager and for the budget team to work with the board to determine if longer term solutions are needed. With the trigger plan that they're developing and with continuous updates and outlook going in throughout the fiscal year, I think they've put together a good plan that balances both that short-term and that long-term picture and needs, and potential strategies for solution. So those are my observations in looking at what's being presented today. And I want to thank you for allowing me to share my thoughts.
Thank you very much, Siri. Let me ask if there are any questions from board members in terms of your observations. Any questions from board members at this time?
Not right now, but thank you.
Thank you. I do want to acknowledge that we have Vice Chair Fowler and Supervisor Parks who have been on the line as well. They joined shortly after we started the meeting. So this was great. Welcome. We have a full board here. Okay, Jimmy, go ahead.
Thank you, Madam Chair. So moving forward, I wanted to clarify that we hope and expect to get into executive session that was discussed earlier this morning by 4 o'clock today. So we have a couple hours, an hour and 45 minutes or so left for conversation, understanding that we are coming back. So the next slide. So again, just kind of an overview of what we hope to intend to cover this afternoon during our conversation. As we've talked about, we will be coming back, Megan. We'll be coming back on May 12th at 9 o'clock. So we're asking for 3 hours on the 12th. Understand we do have a board meeting that evening at 6 o'clock, our regular evening meeting for the month of May. And then coming back the next morning, the 13th at 9, with the ask that we have the afternoon reserved should we need additional time after the 9 to 12 morning session. And then again, the tentative final and the tax rate adoption. So some of the key considerations, Madam Chair and members, you know, as we've discussed before, expected revenue reductions are unprecedented. When we look at the impacts of COVID-19 pandemic, you know, this is an unprecedented event. Even we go back and look at the recessionary years, you know, back from 08 to 10, 11, 12 timeframe. And it does make the accuracy of revenue modeling challenging. So we, after reviewing the three models, the board did prefer to go with an initial recommendation to us that we do support is with a long-term long recovery model. It is a more conservative approach so that the county is better prepared for a more worst case type scenario in the future, and it not having to further cut potentially later on, but also being able to have the space then to take a look further in the fiscal year as we have some additional revenue numbers, and we see the true impact of this pandemic on our state and local sales tax. Again, as we've mentioned before, we do have local revenues through March, but we only have state shared through February. So, you know, with limited data, as we've mentioned, this is a challenge, but we are truly hoping that by Monday we have some additional revenue numbers. So some other key considerations, you know, reopening, you know, how will, you know, kind of re-entry into our organization, but re-entry into the larger economy and how that's phased. Obviously, the governor made some announcements yesterday, but how will that impact the county? You know, you know, and how will that impact potential for, you know, for a resurgent or waves of the disease moving forward? And how does that impact revenues? A lot of unknowns, a lot of variables, as you all know and have been discussed even earlier today with Dr. Peoples' updates. You know, when will travel resume? Not only domestic, but international travel. When you have an area like Coconino County, that county-wide is very dependent on tourism, including international tourism. And when does that start to resurface? And you know, what are the future of businesses, including the, you know, the broader sector of the economy, not just those that have been impacted so far by COVID-19. You know, there's questions, and was discussed briefly this morning also about, you know, where funding will come from. You know, revenue replacement, reimbursements. You know, I read this morning that the House of Representatives was working on their COVID 2.0 and see what that looks like, and that there is a push among some members of Congress to make sure that there is local government appropriations in a future funding bill. And obviously that is very important, especially to those cities and counties in Arizona that did not receive any direct appropriations originally. But, you know, as we know, counties, and especially in Arizona, are on the front line of the public health response. You know, and getting some additional clarity on what funding will cover are the costs that we have expended to date, including the discussions that we had right before the lunch break today. What is the timing of that? Federal reimbursement, we're still waiting for museum fire reimbursement, for example. So the cash flow is an issue. And what are they going to do with additional stimulus moving forward? So some of the principles, when we adopt a tentative budget, we're setting expenditure ceiling. So when we adopt on June 2nd, we're going to say we can't spend more than this. We can cut it before we adopt the final budget for FY21, the end of June. But hopefully, we have to do our best to put forth a budget for FY21 that does account for the unknowns and including providing the ability to expend funds as revenues come in, similar to what we do with grants, where we have unallocated grant appropriations for the grants that we don't know about at the beginning of the year, but make sure we have expenditure authority to be able to spend them in the course of the year. So that's one of the things that we've been discussing as a budget team. I know we'll be doing some more discussions tomorrow during a follow-up budget. We have a weekly budget meeting, and that will be tomorrow, following up on this conversation. So we have goals to make sure that they're understandable to not only to the board and the public, but to our organization, and that there's clear direction provided from the board to us, and that we can then communicate that to the organization. So tomorrow, for example, we talked about the last at the EOLT phone calls on Friday and again yesterday, that we will be using that space Monday, Wednesday, Friday to have some deeper conversations about both reentry and the budget. And Joanne and others are helping to facilitate that, again, preparing for tomorrow to make sure that we are not only providing clear conversation and direction to the departments, but also that is a two-way communication, that we're able to get their feedback moving forward. Some of the principles, we've talked about kind of a worst case, I don't say the worst case, a worst case scenario, and making sure that there's flexibility in here. We do have, expenditure limit issues, not just about we can't spend more than what the limitation we set on June 2nd, but we also have to live within our expenditure limitation, which you all are very familiar with, and make sure we're creating, clear expectations, but also keeping in mind, though, that the 10-year plan is there for a reason, and that we do have recessionary years envisioned in the 10-year plan. That's part of the brilliance of the model, is that when you go into recessionary years, you're going to be, spending some, the numbers aren't all positive at that point. And again, that was the original intent of a 10-year plan and recessionary modeling. But also making sure that we also are looking, both as Siri had mentioned earlier, we have that shorter term, kind of FY21, FY22, but also looking at the longer term impacts of decisions that we're making today. We want to do our best to, as we have talked about with the EOLT, and Chair Archuleta and I had a chance to meet with our constitutional officers last week, and had a good conversation. But we also talked about this on the EOLT call, that we want to do our best to avoid furloughs and layoffs wherever possible, as long as possible, but understanding that there's also a cost to the current turn of the economy, and that, but yet we can do our best to work. We are doing our best to work with departments on, and especially with the vacancy and reclassification team that's meeting every week, to look at every vacancy that's coming up and what vacancies can we hold to also to secure that additional 1.5 million in vacancy savings that we're planning. So again, but make sure that we also are supporting departments, that they can continue to accomplish their missions in serving people and community, but also making sure that we are putting our full shoulder into identifying the opportunities that exist in spending throughout the organization, but working with departments individually. And I think that's part of the key, is there is not a one size fits all for department level cuts, which is why, from a county manager's perspective, for looking through a management lens, across the board percentage cuts, I believe, are unfair, because departments are created differently and not all have the same capacity. And it's key to work with each department to find and identify efficiencies and cost reduction opportunities. Again, and the last point of communication, making sure that we are having that two-way communication and use, again, leveraging things like the town hall we had yesterday, which was an amazing conversation. It provided updates to our team members, but also we had some awesome questions from team members. You know, we had nearly a third of our team participated in the town hall yesterday, and we want to create more of those opportunities, not just during events like this, but moving forward for that two-way communication. So we are looking for, again, we have to, June 2nd would be a tentative, a final adoption for FY21, which starts July 1st, would be the 23rd, and this would reflect the long-term model with some assumptions that we will talk about today, and some being clear that there are some clear expectations of expenditure reductions in departments. But with the absolute commitment to work with departments between now and this fall, or sometime later in the fiscal year, but start the work now to look at what are the highest priorities in the organization, that when we get to a point where things maybe aren't as bad as we are projecting today, that we have an opportunity then to bring back to the board some recommendations. But again, budget is a 12-month conversation. We will continue to have monthly updates with the board throughout the year, and make sure that out of again the base budget adoption, we call it right now, that we are then planning for some further deeper conversations later in the fiscal year. So that, I mean, theoretically in January, where we have 4 or 5 months of revenue for FY21, 4 months for state, and 5 months for county, that we're able to present kind of a more final trigger plan to the new board. But again, that's been continuing finessed and talked about between now and then, and go ahead and update again with some updated revenue and expenditure estimates, and then recommend some potential modifications to 21, and then looking at what that looks like for FY22 as well, and impact on the 10-year plan. And then obviously we go into kind of the more formal budget conversation going into FY22. We'll have to cross that bridge at that time. So, so Madam Chair, is there at this point maybe a quick stop back, Megan, to slide 13? Are there any points or questions that you all have? And we'll continue forward here, including looking at the long-term recovery scenario that we discussed. But any comments or questions for me at this time?
Thank you, Jimmy. Well, let me just ask the board if there are. I don't. Certainly at the end of the presentation, at the review of the figures and the actual spreadsheets that you have, I'm sure then I will have questions, but let me see if other board members do it this time. Board members, any questions or comments at this time for Jimmy? Okay, I'm not hearing any, so go ahead.
Okay, thank you, Madam Chair. So going into more specifically focusing on the 21 budget, just want to review a couple key takeaways from what we believe we heard at our last discussion, but also included in this is kind of some recommendations kind of with it, working together, but informing those recommendations is the intent of staff. At this point, what you will see today is keeping the 1 million flexibility language in the 10-year plan, not making an additional deposit at least for FY21. I want to absolutely stress this flexibility language is a year-by-year conversation and decision. One, the legislature has to give us the authority to use flexibility again, which again, as you all know, is $1.25 million for FY21. That authority is continued in the budget that is currently authorized at the state level. So we recommend that $1 million for FY21 be kept in, is one of the assumptions in the 10-year plan. That there are not adjustments for employee compensation in the 2 recessionary years, FY21 and 22. Instead, for these 2 years, that $1.1 million instead is invested and is considered in the fund balance moving forward. Using the long recovery model for projecting revenue, and again, Megan's going to go more specifically into the long-term recovery model, and then delaying, as you saw last time on the 10-year plan, but delaying at least until FY23 debt service required for King Street, for the debt financing of King Street. Now, reminder on King Street, Deputy County Manager Joanne Keene and Facilities Director Sue Brown will be coming to the board next Tuesday, the 12th, in the evening meeting to give an update on King Street, including RFQ moving forward to look at some options, again, using, some cash in our capital fund to pay for that with the understanding that we would not have any debt service. Again, cross one bridge at a time, but at this point we would have at least not have any debt service at least until FY23. So we had talked about reviewing the 1% escalators for operations. We have taken that out of the 10-year plan, and obviously to continue to review kind of the critical funding issues. We've made some modification to that you'll see today. And you also asked us, and we discussed briefly, looking at kind of the trigger scenarios and other department budget reductions. Again, triggers we talked about briefly, but we would like to potentially move forward with this base budget for FY21, including the longer term recovery scenario, and that we would come back later in the fiscal year when we have more informed information to be able to talk about what those are. But in the meantime, to be talking with departments and with the board about those trigger priorities. So one of the takeaways from the 12th and the 13th also will be to make sure we have some clear policy direction from the board on what those trigger priorities you would like to see us work specifically on between now and the first of the year. So Madam Chair, members, I would like to turn over the presentation to the Interim Finance Director, Megan Cunningham. But before I do, I'd just like to thank Megan again for her leadership and to the budget team, John Comer and Megan Coons for their work in difficult times, but creative work, and really helping us work with the management team, with myself and the DCMs, but most importantly, working in partnership with the departments and how we find department level solutions to get us through these times. So Madam Chair, members, I'd like to turn the time to Megan Cunningham.
Good afternoon, Madam Chair, members of the board. Can you hear me okay? We can hear you. Yes, Megan, thank you. Okay, I don't have my camera on because I've got way too much going on here with the slideshow and being able to talk that I don't know where the camera button is. So if you're okay with that, I'm just gonna.
No problem. We can see the slides. I understand.
Okay. So going into this portion of the presentation, so preparing as we talked for the worst or a situation of the worst, and hoping for the best, we are using the long recovery recession model. As a reminder, this model shows a massive decline in the end of fiscal year 20, with the fourth quarter showing local sales tax having a 38% decline and state shared sales tax having a 31% decline. This massive decline continues through fiscal year 21.
And then recovery begins in the second half of fiscal year 22, but this is a weak recovery and it continues to be weak until fiscal year 23. So following our conversation on April 28th, based on feedback, we made some changes to the long recovery model. And these are the changes that we made. As County Manager Jane mentioned, the flexibility language funding is being used to address the issues of the recession rather than being used for the pension pay down. Funds originally set aside for employee compensation have been placed into fund balance to also address the recession. And these are one-time dollars. It was $550,000 in fiscal year 21 and $550,000 in fiscal year 22. We added an estimated annual operational savings of 1.5 million, which, if some of you will recall, we also refer to this as lapsed funding. So at the end of each fiscal year, we recognize operational savings. Each department tends to sometimes come in under budget for whatever reasons. It could be efficiencies, it could be just a change in need. And these savings go back into the fund balance for future spending. We haven't typically accounted for the lapsed funding in the outgoing budget years. We really only look at it when we're looking at the actuals. So we've added these savings into our 10-year projections, and the amount is 1.5 million moving forward, which we feel is a good estimate looking at trends and from the past. Other items for consideration, we have identified a reduction target expectation of approximately 1.5 million for fiscal year 21 and 22. And again, that's part of that short-term into the longer-term planning that we'll talk about once we have a base budget. And then we also identified the opportunity to continue to use the flexibility language in fiscal year 22 and fiscal year 23, provided the authority continues to exist and that the board chooses to use it in another manner rather than continuing the pension pay down. But again, as County Manager Jane said, those are discussions for the years to come, but these are opportunities that we identified. Also removed from the 10-year plan is the potential judge salary increase of $215,318. As we talked earlier, we heard that we wanted some consideration looking at the 1% operation inflation amount. Well, we went in and we reduced that to 0 starting fiscal year 21 until fiscal year 26. And in fiscal year 26, it returns back to the 1%. We added recommended mandated and mission critical SIRs. And just to give you a little bit of perspective, out of a total request of 7.9 million, we are only recommending 1.7 million, which is 22% of all requests. We also added one-time project carryovers, which were requested at a total amount of 1.8 million, and we are recommending 882,000, which is 47% of the request amounts. So the assumptions that have not changed from our last conversation, but are worth mentioning again, we have vacancy savings target of a total of 2.5 million from fiscal year 21 to fiscal year 23. And we begin to taper down that amount in the outer years. And we taper it down in the event that as we start to see recovery, the vacancy, keeping vacancies might be a little more relaxed at that time. No compensation increases for fiscal year 21 through fiscal year 28, but we will look at triggers, which would allow a change in this assumption if revenues rebound sooner. Again, we've mentioned prior in the presentation, the King Street remodel and expansion debt service has been delayed until fiscal year 23. And we also anticipate estimated savings of $100,000 for the personal day purchase participation. The next assumption that it remains the same is the Public Health Services District funding transfer. So this, to remind you, this is a transfer from general fund to the Public Health Services District funding source to pay increasing mandated costs. And you can see for fiscal year 21, We have that cost estimated at $400,953, but it substantially increases from 22 to 28 due to the anticipated increases in these mandated costs. We have the tax settlement of $1 million set aside. This is the Transwestern's tax settlement, which at this time will potentially settle in fiscal year 21. We have for COVID expenditures, we've programmed in about $4 million between fiscal year 21 and 22 to come out of emergency reserve. And then in fiscal year 21, we have a 75% reimbursement of $3 million programmed into the 10-year plan. These numbers will be updated as more information comes in and we have a better idea of costs and revenues. So at this time, and I gotta stop sharing this because I'm gonna bring up a one-page handout, which we would consider a snapshot of fiscal year 21. So what this is gonna show is what we currently have programmed in the 10-year plan for fiscal year 21. So bear with me while I pull that up and share it.
And I would assume we don't have a copy of this one just yet?
Not yet. No, you are correct in that. Okay, now I need to share again.
Madam Chair, while she's pulling that up, could I throw a thought into slide 23 real quick?
Sure, go ahead, please.
So you know, Megan talked about, and she showed the from FY21 to about 401,000 of general fund to help pay for the state mandates. You know, the PHSD kind of fund balance that had been built up over the years will be that savings account will be essentially exhausted at that point, which is why you see such a marked difference between FY21 and 22. And then you have an escalator built in there for access, all techs, you know, the state mandate costs moving forward that I know some board members have asked about previously. We will bring that Public Health Services District chart that we showed you the beginning of January. We will bring that back next week so you can see the difference between what PHSD is generating in revenue with a secondary tax, what's used in operations, and then how that fits into the state mandated expenses and the methodology that goes into also the future escalation of those expenses to make sure that they are accounted for appropriately. Thank you.
Thank you. Okay. Let's see, and then Megan, I think, yeah, we see this on your screen, but I think Lucinda also said that she had a correction that she needed to make. And so, Lucinda, did you want to offer that correction now?
Yes, thank you.
Sure.
Just to be clear, it's really a clarification on slide 22. That top bullet says vacancy savings target / expectation, $2.5 million from FY21 to FY23. It's actually 2.5 million target per year over that period. So the period over that 3-year period, it would be obviously 3 times the 2.5 million. I just wanted to make sure that was clear to the board. Thank you.
So it would be 7.5 million.
Correct.
Right?
7 million, right? So, no, 7.5. Thank you.
Okay, great. Thank you for that. Appreciate it.
Thank you.
Okay, go ahead. Megan, we have the document that you're referring to on the screen.
Okay, so this is a handout to show you the snapshot we have of fiscal year 21. So what you'll see in the left column are all of the revenues or revenue offsets we have in the fiscal year 21 budget. And then we also have on the right side the expenditures that we have included in the fiscal 21 budget. And these are the numbers on the 10-year plan. Down at the bottom, this is where we're going to talk about the structural deficit that we're seeing and the fund balances. But real quick, I want to remind you that we have the emergency reserve set to a total of 15% of revenues. the remaining fund balance is allocated, that the remaining fund balance that we have is then allocated to the unreserved general fund. So we've got two sections of, so our fund balance is kind of split. We've got the unreserved amount, and then we've got our emergency reserve. So the 15% consists of 10%, which is set aside for emergencies. So the remaining 5% is for revenue smoothing, which was created to come to aid during a recession or a downturn in revenues. So just kind of wanted to rehash, what our fund balances are intended for, and go from there. So looking at our revenues and offsets, you can see that our base revenue is the 66 million. This does include the downturn of revenues. Then we have vacancy savings, which is $1 million, and that's our norm. That's the anticipated norm. We did add in 1.5 in anticipated additional vacancy savings due to the vacancy review board and the likelihood of more vacancies being held open. And then, as I mentioned in a previous slide, we have the anticipated operational savings. And this is what we have referred to in the past as lapsed funding. So it's funding that comes back to the general fund balance. We have $1 million in for use of the flexibility language. We have the one-time $550,000 for that was originally set aside for the employee offset, but it's now in the general fund to address the recession. And then by removing the 1% inflation for operations fiscal year 21 through 20, I think we said 23 or 24, savings for each year is 104,000. So looking at all the revenues that we have budgeted and the revenue offsets, we have $72,430,704. Now looking at expenditures. For salaries and benefits, it's 48.6 million. And these are our base budget. So this is just what we have from year to year. Base budget operations and travel, 22.9 million. And then our base budget for capital in the general fund is $5,452. What we've done is we've added in the mandated mission critical that were considered recurring. We have the one-time mandated mission critical, and then we have the one-time carryovers, which leaves us with the total fiscal year 21 expenditures of 74.3 million. So the question, and so that brings us down to fiscal year 21. We have a structural deficit, meaning we have less revenues for the year than we have expenditures, is 1.9 million. If you look at our unreserved general fund balance at this time, it's $15,294. And why that is because this calculates the emergency reserve and revenue smoothing dollar amount here, calculates at 15% of revenues. And then whatever's left just automatically goes into the unreserved. So we have the capacity to use some of the revenue smoothing funds, and leave the unreserved obviously alone. But just so that you know, this is a total dollar amount, and the unreserved is just the difference of the 15% of revenues. So the decision to be made is, would the board like to see us come back and identify other ways to cover the 1.9 deficit? Or is the board comfortable using the revenue smoothing at this time as it was intended for the deficit? Are there any questions on this handout before I head back to the PowerPoint?
Thanks, Megan. Let me see if there are questions at this time. It looks like Supervisor Ryan has a question.
Yeah, thank you, Madam Chair. Megan, the 9 million, is that at 15% at this point, or
Yes.
is that after drawing down from it?
That is at 15% at this point.
Okay. Okay. Thank you.
Other questions at this time?
I have a question, Madam Chair.
Sure, Supervisor Babbitt.
So I do have a question on what was built in. So some of this is new since the other day, and so I tend to be view some of these with a pretty narrow lens, I think. I just am interested in the operational ongoing savings of 1.5 million. I look at what has been a trend about some of our departments coming in very, very significantly over budget through no fault of their own, but I look at the capital murder cases, I look at judicial, I look at overtime issues that have been playing in, and I'm wondering in this time of incredible need and response, if it's really the
Are we fully?
Supervisor Babbitt, I can't hear you anymore. So let's see. I don't know if you lost connection or if maybe you just pressed mute by mistake.
Supervisor Archuleta, Supervisor
Yes.
is here. He is unmuted, so he must have a connection issue.
Okay, so maybe it's a Wi-Fi issue. Okay, let me go to another member of the board and then let me just communicate with him through the chat function to let him know we cannot hear him. Is there any other member of the board that would like to speak at this time? And you'll just need to unmute if you would like to speak at this time. Okay. Let's go ahead and go back to Megan, and we'll get Supervisor Babbitt back on the line shortly. It actually looks like he may have disconnected and trying to get back in again. So Megan, why don't we go back to you to see if there's anything else that you want to present at this time.
We have just a couple more slides on the PowerPoint, so I'll need to go back to the PowerPoint.
Okay, why don't you go ahead and do that?
Madam Chair?
Yes, Vice Chair Feller, go ahead.
Megan, I have a question about the presentation you just delivered. I'm just wondering about something that Supervisor Babbitt brought out, the cost that is happening that we've been really tracking and keeping an eye on, which is the high costs in our court system and our I wonder if that is already in the presentation that you just presented. Those costs, were they built in there? We're thinking about maybe somehow taking care of them, like, and we had some other maybe staff be brought in instead of doing contract attorneys, and I can't remember what else. And I see Jimmy on, maybe he can answer.
So Madam Chair, Vice Chair Feller, Megan, if you want to give an initial response, and then I have some follow-up that I'd like to share as well.
Absolutely. Madam Chair, Vice Chair Feller. So in looking at what we call lapsed funding and our operational savings, we look at, overall trends. And all the way back from fiscal year 15, we've had lapsed funding operational savings in the amounts of 2.8 million, 2016 was 2.9 million, 18 was 2.6 million, and 19 was about the same as 18. So we're seeing that trend continuing, even with, having to increase criminal justice budgets by, another $130,000 for, contract attorneys or whatever else we needed to add during the fiscal year. So these are operational savings that are being recognized even with those expenditures occurring.
So, Madam Chair, if I could add to that, thank you, Megan. So part of, is it okay if I go ahead?
Oh, please do. Yes, thank you.
Yeah, thank you. So, so part of, I know there's been some talk and some angst about, one-time recurring additional for FY21. Part of truing up some expenditures, like in the justice system, that we have not trued up previously. We have, budgeted $415,000 for, I think my number's correct, Megan, for RTC, but spent well above that the last couple of years. So what part of our request in helping to true up some of the justice expenses are things like the legal costs for outside contracts and restoration to competency, where we have some track record of what we expect to spend. One of the things we will be doing in coming back on May 12th is likely taking those and turning them into one-time expenses, not knowing exactly what the expenses will hold for FY21. But in doing that, then it also gives us an opportunity, both on the revenue and the expenditure side, later in the fiscal year, as we talked about previously, to take another look at where our revenues are and where we are in expenses. Adopting, and I just want to be clear about this, that when we recommend and the board considers and adopts a tentative budget on June 2nd, and then a base budget for FY21 at the end of June, that's a point in time. We will, later on in the fiscal year, we will come back to the board. We will be talking with departments in the meantime, but come back. This is a different time and a different scenario than the traditional budget model that we in public organizations have followed for years. Even in the recessionary time, this was a slow ramp up to the Great Recession that happened. This was not turn off the lights overnight, which is what's happened with the COVID-19 pandemic. And we don't know how that dimmer switch we've heard now, as an analogy, we don't know how that switch is going to actually turn up. Nobody does. We are doing our best as staff to help inform what we expect to be loss of revenue in FY20 and in FY21. But it's a guess. But we're doing our best to inform that guess the best we can by both economic experts and also experience and what other organizations in our county and our state are also looking at doing. But again, I just want to stress again that this is a point in time that we are recommending, some pretty large actually reductions, and that will be a weekly conversation. And the credibility of this means a lot to me. That this is not we have a budget season, in March, April, and May, and then we'll see you again in April. That is not the case. It's a 12-month conversation. We have weekly budget team meetings. Things have changed in the communication and the look of our budget that has existed previously. We look at this now as a team every week, and we will be looking at expenditures. We will be looking at revenues every week and making sure that the cost reductions that we are committing to as an admin team, as a budget team, as an organization, across this organization are going to be met, and making sure that we are holding true to those, but we are also being very transparent with the board and the organization on where we're at with revenues and expenditures. So this is going to be a longer term continued budget conversation. I've really stressed that budget is a 12-month conversation, but now it's a weekly conversation in looking at revenues and expenditures, in working in partnership with our departments. We don't exactly know what this fall is going to look like, but we believe at a staff level that the recommendations that we're putting forward now, that then will be further developed, including like the trigger scenarios we've talked about and the policy that the board will set on what additional dollars will be put forward. We don't know what's going to happen, back to, I believe, where Supervisor Babbitt was going with his question. We don't know what's going to happen with things like with death penalty cases or in the judicial system, which is what we don't know, like on any given year, right? But it's also part of us asking to put some more pennies in the justice-related pot in the two areas that I specifically mentioned, to make sure that we have enough to cover those, because that's something that we're looking at weekly and reporting on monthly now, because we don't have those extra pennies laying around when Marty Delgadillo comes and says, I need another $250,000, and we just don't, it's not laying around right now. And so we need to be more cognizant of those issues going into FY21 than we have previously. Thank you.
Thank you very much. Let me ask if there's other questions from the board. We do have Supervisor Babbitt who has joined us by phone, and he's been on the phone, so he is listening to the conversation. Want to just make sure that his phone is activated now. So Supervisor Babbitt, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes, perfect. Thank you. Go
Great.
ahead.
Awesome. Yeah, thanks. So just to wrap it up, I did finally reconnect a little bit to hear Jimmy's comments, but just the underlying assumption is, our operational needs going to go down or up? I mean, he's right. No one knows, but my senses are going to go up based on the conversation like we had today, like we're going to keep having on rental assistance. So, there's not a one way to answer that question for sure. The last piece that I wanted to get to under base assumptions was, I know there were a couple of us who had some concerns, me specifically, on utilizing JLBC numbers. They are often too rosy and liberal as history looks at them. So I was wondering that, obviously, I think Matt and I were the only ones who overtly spoke up. Just wondering if that was addressed in any of the conversation.
All right, thank you. Jimmy?
So Madam Chair, Supervisor Babbitt, that's a fair question, and you and I have specifically talked about that. And coming out of that world, I'm very familiar with that organization. So as we spoke of previously, the team did a great job of doing some research, and that specifically also data for Coconino County, especially with our county sales tax, which is why we have recommended a 38% decline for the last quarter of FY21 for our county sales tax, reflecting more our local nature. 31% obviously is what JLBC is predicting for quarter 4 of FY20. That's the number that we have recommended using out the gate. But Madam Chair, if I can, I want to turn to Megan Cunningham or John Comer. I know, John, you did quite a bit of work working with Megan Coons as well, but I think, John, you did quite a bit of work on, with the Deloitte model, and you all as a 3-person budget team feeling comfortable with a 31%. So I'm going to look to you all to answer that part of the question, if you would.
Yeah, and if we could also maybe just go back and maybe reiterate or repeat the based on the long recovery, like the base revenue based on the long recovery that we were talking about. I think that would be good, just to go back and restate that, so that we all have that information as a board.
Megan?
I'm back. I was on mute, sorry. So first, to address the 31%, John really got in depth and looked at, GDP versus what, we're seeing, and how we really can't relate to that. And it was very, very extensive. It was, and we're on the same boat. When we see JLBC numbers, we're very hesitant to use them because they are rosier. But then also looking at the 31%, and we're saying, okay, that they're saying that number, that's the state overall is 31%. We're saying just us, county is going to be 31%. So we felt with everything that we looked at in the Deloitte models and, doing all the comparisons with changing the categories and, where do we receive the most of our funds, that we feel that at this point, we feel good about that 31%, but obviously it's going to be revisited when we have some more data. And we could have to adjust down, which again, and we'd have to adjust any expenditures down. So it's still evolving, but we do feel that at this time it's a good number to start with and keep track of on a close basis.
Madam Chair, I'd like to hear from John directly.
Sure. Yeah, I think it'd be good to hear from John, and then also I would love to have restated what we were saying about the operational savings. I think that would be important just to make sure we all have that information. So John, go ahead.
Hi there. Can you hear me?
A little bit louder. We can hear you, but just a little louder would be better.
All right, you got it. Can you hear me now?
Yes, thank you.
All right, great. The only thing I'd add to what Megan said was that 31%, we did start with JLBC numbers, and we recognize that they are a bit rosy, but that it was a starting point, and we are ready to really be flexible with it. The kind of mechanism that we built behind the 10-year plan is really ready for any percentage decrease in FY20 to be thrown in there, and then we'll really see how it carries forward into the next couple of years. So really the 10-year is really more about the mechanism of creating a system in which we can plug in numbers as we get them. And we're really all chomping at the bit to get to May 11th so we can find out what that first decrease really is.
Great. Well, that's great. I mean, there's no right or wrong answer. I appreciate the perspectives. And then I'll save my offset to the reoccurring and one-time costs for when we close. I do have, thoughts on where the specific offsets to that budget deficit are. So we'll let them go through. Thanks, Madam Chair.
Great. Thank you. I appreciate that. And then Megan, I just wanted you to go back over about the operational savings, please.
Absolutely. Madam Chair, Supervisor Babbitt, I understand your concerns of the 1.5 million in operational savings in light of things, and are we going to need those dollars? But what I had shared when you got cut off is that looking in the past, in 2015, we had 2.8 million in operational savings. In 2016, we had 2.9. 2017 was a little bit lower, but we had 1.6. And in 2018, we were back up to 2.6. And we're seeing that type of trend in 2019 as well. So we're estimating lower than what we're seeing. And Supervisor Fowler had a good question on, the things in the criminal justice system that we're having to increase due to just the changes in pace and everything. And this is even with those increases, we're still seeing these operational savings. So, we have departments saving in areas, and we have other departments that are right on budget, and we have departments that are over budget. But at the end of the fiscal year, all of those mixed together, we are still recognizing quite a bit in operational savings.
Great, thanks, super helpful.
Okay, other questions at this point? If not, we can continue to move on through the presentation. Okay, go ahead, Megan.
Okay, back to the PowerPoint. We're on the slide 25 that says recession plan. So moving forward, we will continue to solidify our recession plan. We're going to work on identifying a phased approach to address revenue as data is available. County Manager Jane said it best, you know, we're going to be looking at this stuff weekly. We're going to be picking, you know, every little piece of information that we get together as a group and we decipher it and we figure out what it truly means and what we need to do for Coconino County. These phases will be outlined by the budget team and presented to the board the week of May 11th. So next week we'll have some of these thoughts to bring forward to you. And to note that some actions during the fiscal year or even during our budget adoption may require Board of Supervisor approval or the look at some policy changes. But these will all be part of that conversation as we identify the phased approach as we see what our revenues are coming in at. So
hang on a second.
Sure, Supervisor Ryan, go ahead.
If I could hop in.
Yes, go ahead, please.
Yeah, thank you. So, you know, one piece, just, you know, thought popping in my head as we're going over this right now, Jimmy, is we get these mid-year adjustments that are occurring or partial year adjustments where people are coming in with modified reoccurring, et cetera, on that. It would be really good if anything like that were aligned with these budget updates that we're dealing with, that we're going to have them regularly. I think that will help us keep a you know, a better vision associated with what the overall budget and impact of those kind of things happen. So it's one, I think we want to be just a little bit more aggressive on how we take a look at you know, what comes in with requests related to our meetings throughout the year. Just a thought on that.
Madam Chair.
Yes, please go ahead, Jimmy.
Yeah, thank you, Supervisor Ryan. I could not agree with you more. You know, I gave you the example of restoration to competency, for example. You know, we had a base budget of $415,000, but we spent twice that in FY19 and $700,000 in FY20. And again, those have been more perfunctory in the past, but you have our absolute commitment that in our weekly conversations, in our at least monthly updates with the board, that we will be looking at those and working closer with like court administration on where these costs are going, so that we know that we can we will track them closer. They do a great job of tracking them, but we'll be making sure that we're on the same page moving forward on where RTC is going. I don't mean to keep harping on that. I just have the number in front of me, that we can look at it throughout the year and know that where those costs are going, and the factors that are going into that. So you have absolutely, you have the commitment of the team to make sure that we are making sure that we are informing those when they're coming before the board, that here's what we appropriated, here's where we're at, you know, here's where it is anticipated going, not only, you know, for that month, but through the end of that fiscal year.
Mm-hmm.
Yeah, thank you. You know, just it's more of a fiscal discipline, you know, just yeah, how things would occur over the year, and then you start to lose track of that broader, you know, let's just be more regimented about what we're looking at. We just have to be double checking ourselves on what we're doing here. Thank you.
Supervisor Ryan, I also wanted to call on Lucinda to make some comments around this as well. Lucinda?
Thank you. I think you just summed it up, Supervisor Ryan, that what's going to be really critical, particularly the first 6 months of fiscal year 21, is that we are, with the delay in receiving information from the state relative to revenues, we're not going to have a sense of a trend until probably earliest maybe November, December. So frankly, in reality, we have to hold that budget, the budget that will reflect these cost reductions that were outlined in the one pager. We have to hold those through that 6-month period in reality to be able to then look at, okay, what is occurring? And then probably in the January timeframe, say, okay, where are we? And do we have the opportunity to potentially address some of those budget adjustments as you identified, or do we not? Or do we have to impose greater cost reductions? You know, where are we at that point? Because of that lag, and I'll also add, because of expected resurgence of the disease coming in this fall with flu season, I think the sense of the team is we have to be very conservative through that first 6 months. So I think departments are going to need to be prepared to identify, all the savings that they can in that period of time, so that we can have as much, frankly, flexibility and understanding going into the period that hopefully we do have a little more information. Thank you.
Thank you.
Thank you. Other questions at this time? Okay, go ahead, Megan.
Okay, so back to the PowerPoint. The next slide we're going to look at. So we have the 10-year plan, which this is the long recovery recessionary model that we've been talking about all day today. That includes all of those items that we have discussed, that we added or we took out, or it has all the vacancy savings and such. So this is in line with that handout that I showed everybody that has the $1.9 million deficit, that we can either identify areas to try to find that, or we could use the revenue smoothing to get us through fiscal year 21 and for our continued planning. So that's just an update on that plan. So just in conclusion to what we've talked about today, while we are uncertain about things today, we as a county have a strong foundation of planning for the future. We have measures in place to address predicted shortfalls and unprecedented impacts. We need to maintain flexibility in our fiscal year 21 budget in order to pivot when needed, when we have those revenues that come in higher, or we have those revenues that come in lower. We need to have the flexibility to be able to make those adjustments to our expenditures as needed. We will continue to work closely with the Board of Supervisors and departments as we progress through this time. And as a reminder, we meet this, our County Manager Jane has mentioned a million times, this is a 12-month process. This is no longer just a 6-month process, and we are meeting weekly, and we are trying to keep everybody informed on the current information that we have. And that's all I have as far as the presentation goes.
Okay, thank you very much, Megan and all. Appreciate all the work that's gone into this presentation, and also, building upon every work session that we have, refining it as we go forward. And so now's the time for us to enter into any discussion about this at the board level, and to talk about, it can be, impressions, perspectives, what other information do you need going forward as we go into some of the further discussions about the budget and beginning to set an FY21 budget. And so maybe Jimmy, just turning it over maybe to you in terms of what you're looking for today from the board. Is it primarily perspective? Is it any type of direction going forward, or what would be helpful to you today from the board?
Well, thank you, Madam Chair. I think a key point I speak for myself and the staff, and right now, understanding we, I think, hope to get to executive session about 4 o'clock. This is an opportunity and space for input from you all based on what you've heard over the past months in the presentation today. Any observations or thoughts that you have that we can then take into our budget team meeting tomorrow, coming back to you all next Tuesday, the 12th. So we'd love for you all to have some conversation that we can take note of and make sure that we are preparing best for next Tuesday based on the recommendations that you saw today.
Right, and just so we're all reminded, we will have budget hearings May 12th and 13th, and so we will certainly be able to make decisions and provide direction then. But if there is something that any member of the board would like to share today to further inform the process, we could welcome it at this time.
I'll start out, Liz.
Oh, sure. Go ahead, Supervisor Ryan.
I really appreciate taking a look at the conservative approach on what we're doing here. As we've continued to speak about the unknown that's coming up, you know, just the type of impact that's happened to the economy nationally, globally, and then regionally, which is we're probably going to take a heavier hit just because of stronger dependence upon tourism and the potential impacts. It's really important that we did that. We are sticking to the model of recessionary averaging, but reducing our projected reoccurring cost over time, eliminating that 1% increase is very important. The piece that we need to be ready for, we need to, you know, as noted, and is repeated in this model, the ability to pivot. Along that line, some of the unknowns that we've all talked about a little bit is the potential for an uptick on the judicial and law enforcement side is there. There are going to be people that are struggling, and if you don't have a job and you don't have a means, you still need to survive. We hope it doesn't get to that point, but I think we've already seen some modification of trends. There may be other demands that we may need to adjust to, which are, you know, get closer to the base needs of what is the impact to housing, what is the impact to food supply. Fortunately, you know, there are discussions of the CARES Act at the federal level to bring in additional funding, and then distribution at the state level to affect the investment in, you know, items such as food banks. But we're still going to go through different levels of discovery and what to do associated with that. And even with that, we still have our state mandated missions that we have to do. Even beyond that, the state's budget, they paint a rosier picture as we talked about. We know that the typical behavior of the state is, rather than modifying their revenue situation, though there's potential for unfunded mandates that come our way, or additional costs that we suddenly have to absorb that we get from the state level. So it makes perfect sense that we step into this very cautiously, and that we're holding vacancies as we are. Along that line, if we really get into a difficult situation, you know, my thoughts are, you know, a couple of them. One is, you know, how do we adapt to societal needs? Can we respond and get to a level of redefinition of what we do? Even though our resources may be down, we will have greater demand coming in. And, you know, I keep talking about the idea of what if we created our own jobs program? Pretty much, it's not like we're going to have new revenues, but unless it's coming from this federal distribution of money that comes through the state. And then I'm starting to lose track of my thinking here. There was one other point I was going to make, but I'm kind of, oh, I know what it was. The one other piece is, if we get into a better recovery, as Siri was mentioning in the beginning, as Megan and John were mentioning, we have that potential of there may be revenues that are a little bit more than, say, our projected. Let's be conservative and make sure we adjusted things. If we get into that, the note that we're talking about the flexibility language, which is another one that is assisting us through this. I'm good for this year, but I don't want to project for, and we know we only get that allocation annually if we can fight for it, as we have with the legislature and have been able to do it, but continue to do the buy down related to the retirement systems. That's an incurred debt that could potentially go back to growing, and I would like to, again, use wise fiscal management where we can't this year, but in the future, I hope that we can move in that direction. So just generally speaking, I mean, these are the patterns I'm looking at and thinking about as I'm looking at how you're presenting our model right now. And appreciate all the work that everybody's been doing, to try and help us work our way through this. That's enough for now, and we'll see where the dialogue goes here.
Thank you, Supervisor Ryan. Other members of the board?
Madam Chair, would you see if someone else is able to go? I'm trying to find one reference document in my pile here.
Sure, absolutely. Vice Chair Fowler or Supervisor Parks, are either of you wishing to comment at this time? And you would just need to unmute. Vice Chair Fowler or Supervisor Parks, would either of you wish to comment at this time? Okay, now both of you are muted at the same time.
Oh.
So we'll go with, so go ahead. Supervisor Parks, go ahead.
I don't have much of a comment. I realize that we're in a really tough time here, and I really am having a hard time balancing continuing the closure of our economy here with
Oh, I'm sorry, Supervisor Parks, I think you muted yourself again right in the middle of one of your sentences. So there you go. You were just saying that you're having a hard time balancing the closure with, and then that's when you got muted.
Oh, I'm having a hard time balancing the closure of our economic, well, I'm having a hard time balancing the closure of the COVID-19 mitigation here with the closure of our economy. I'm having a really tough time with that because if we don't, I've mentioned this before, if we don't get these businesses back in operation where people are losing their businesses and losing their jobs and losing their lives, we're going to have a tough time because there's not going to be anybody left to pay the taxes. And that's where we're at right now. We're trying to figure out where are we going to get the revenue after as this time goes on, as this COVID-19 problem goes on. I probably should stop and just think about things a little more and let Supervisor Fowler get on. So I will stop.
Okay, thank you. Vice Chair Fowler?
Thank you, Madam Chair. I just want to thank our staff for really working on this probably on a daily basis and then meeting once a week and just really concentrating and then concentrating on where we are in reality and where we're headed. and all the department heads. This is very difficult for everyone to go through. And then at the same time, you know, and just how we're all isolated and having to, you know, work through this pandemic that we're all trying to address. So, but I do agree with the presentation on the long-term outlook, the model that's been presented. I am concerned about the judicial system and some of the high costs that was presented to us. I don't know if they're going to end up having to come back to us again. And then with our law enforcement as well. Those are big concerns. And I really like how the key considerations were pointed out. You know, we don't know when the people will be feeling like they're safe to travel again. We're a tourism community. Yes, we're very concerned about our business. I think as we, the business community, and as we go through the process, we have to make sure that we continue to lobby with our congressional delegation and other elected officials to really look at some dollars for these micro businesses and businesses that were left out of the that were not able to obtain these stimulus dollars. I think that the healthier the community is, the healthier that we will be as well here. And so that's just really looking at the, we have to look at our community even at the same time when we're putting our budget together. I can't believe that the state would send unfunded mandates to us again, but they're very good at doing that. And I keep thinking we shouldn't discuss it here because they'll hear us. But it is just, I think that the way that it is outlined and really taking into consideration on all the different possibilities and how there are trigger points that are going to be set, I totally agree with that. And because we just don't know what we're walking into. So anyway, I think this is good. Hopefully we'll be able to get some of our dollars back. And I still think that we should be lobbying, and I believe we are, for the O'Halloran Bill 4318, the Promise Act, and throw it into the saddlebag when the next one of these stimulus bills is happening, and that will be able to help our region. This is very difficult times for our communities because we just had our major employer close, NGS. We had Peabody close. Many people without a job, high-paying jobs just left our county. And that is going to have a huge impact on us. These are the homeowners, they're the shoppers, they're the ones that were really played a vital role in our communities. And here we don't have them anymore. And so that adds to just the situation that we're in right now. So then those close, and then the pandemic on top of that, I just have to really wonder about just the essential needs that people need. How do we, where is that? And I think that because of that, we got to be really careful with our own budget and seeing how we how we will move forward. So that'll be my comments right now. Thank you.
Thank you very much, Supervisor Fowler. Supervisor Babbitt?
Great. Thank you, Madam Chair. So out of the gate, just really super appreciate a ton of work that's been going in. I really did think last week was a good conversation to help get us down to some foundational understandings on what this road is going to look like, at least from a fiscal planning process. So, I got a few comments and observations and thoughts around here. And so I'll just kind of go in no particular order of prioritization. I just want to make sure I understand a couple of things, and that is in this current spreadsheet, we are funding the reoccurring of 900,000 and one-time 876,000 per the requests from service improvements requests. That is in, and that is planned to go forward, correct?
That is correct.
Okay. Great. Was one piece I need to make sure of, and we'll get to that probably at the end, because that's I think the biggest challenge I have. So, so in no particular order, as someone who, like all of us, have had our experiences with the Arizona legislature, if we do not think they are going to balance a seven-figure, greater than $1 billion deficit on the backs of local governments, we need to watch the tape that gets played out every time the going gets tough. So I don't kind of see how that's embedded here. It goes exactly to what Supervisor Ryan talked about, how we embed that reality. It's not a question of if, it's a question of that's how they do their work. They balance their budget based on sending costs downhill to those so they don't have to ever talk about revenue, that they don't ever talk about fees. And so if we don't think that's going to continue, I think we're not living based on what history has shown us. And so I would, I just think that that's going to be part of this planning, and I don't see it embedded in there. All those incremental, minute little things that we, whether it's little bits of HERF money that come back, my assumption and my base fiscal forecasting would say those are just going to double down. I mean, it's, I think, a $1.2 billion budget deficit next year. They're going to balance it on our backs. That's what they do as a whole. And I'm not saying everyone believes that down there, but that certainly is what the mission is, or that's how the reality has played out. So I'm not sure how I'm seeing what Supervisor Ryan talked about and what I believe absolutely is going to occur is embedded in the budget. Secondly, we have made some unbelievable, impressive, visionary and innovative investments in the last 6 weeks. We, through the leadership of IT, Matt Fowler, and a whole bunch of people who work with, under, and for him, have transformed how this organization functions. We have ripped off a Band-Aid that I hope we ask ourselves what part of those Band-Aids should be left off and not put on. And I'm talking about those new way of doing business that doesn't require 4 walls and a door on a leased facility. We have and I'm not naming departments because they're, I'm naming them as examples. We have human resources. We have IT who are in lease spaces that we are in this conundrum. We have pulled off a Band-Aid that allows innovation and a vibrant, adaptive organization to prosper. I hope we keep those Band-Aids off and take risks in this time that are appropriate to get out of some of this lease space, to understand you don't need 14,000 square feet for every department, that we can shuffle and adapt. I had the most inspiring conversation with an employee the other day And we talked about this, about, hey, how's it going? What are you liking? You know, they're just incredible. There's incredible excitement around what the opportunity to keep this Band-Aid off in a way that not only serves happy, productive, engaged employees, but serves the underlying fiscal bottom line of the organization. I sure hope we don't go back to business as usual in some of these endeavors. And it was one of those really rare conversations, super simple, not long, but you could just hear how excited some are to take that next set of risks and some of the next steps as an organization. I hope leadership capitalizes on that and implements that in this budget. And that's going to take risks. There's no doubt about it. So second to last thing is process for me. So I understand budget. Jimmy does a great job, and Joanne does a great job, and John and Megan about understanding this is a process. It is a process. I just want to, some of the things that gets my attention in budgeting, and it has for many, many years in public office, is when we discover, if you will, funds to balance or mitigate a budget. And I know we want sharp pencils out there. I know that's really important. But at the same time, I want to make sure our budgeting is based on, transparency, disclosure, and accountability. And so when $1.5 million shows up in operational savings, don't get me wrong, I'm glad we're having that. I may have questions on whether it's the right size, but it does get my attention how it just showed up and why that was not in conversations ahead of time. I think another base assumption I just want to verify, Megan, is this saying there's no employee raises for the next 10 years?
Yes, that is what it is saying.
Okay. So I think that's an unrealistic assumption. And I want to be careful about using what my idea, believe me, you don't want to understand what my idea of unrealistic or realistic is. But
I agree.
But to me, that is a means to achieve an end that I think is highly unrealistic. I doubt if we went in the room, if you'd get 5 of us to support a foundational belief that we're not going to do raises in the next 10 years. I'm not saying it shouldn't be in there. I'm just saying my observation, and I want to be in the realm of reasonableness. I like that it's evolving, but I also, it catches my attention when things show up when it comes down to this point. So this gets me to the final piece, which is the new expenditures, which are defined as mission critical and mandated pieces that are not insignificant. It's, almost $1 million of ongoing, and it is almost 800 or 900 at one time. And I have spent a lot of time, assuming this was going to stay in here, of how I get my head around signing off on that, given this reality without defined offsets. We started talking about it last week. To me, it's not going to be met with reduced travel. It has to be met with, contemplating decisions sometimes that are not popular or are very, very, very difficult. Jimmy and I had this conversation. When our top priority is keeping the team whole, that has just defined what your ends are. And all the means to serve those ends are going to be utilized to keep the team whole. I do not, in a great world, I do not hope we have to lay people off. But I got to tell you, if I look at every other local government around us, that is part of the plan. And so I don't enjoy that, but that we are out of the gate defining what our top priority is as keeping the team whole is a challenge for me. And my top priority, to be brutally honest, is not keeping the team whole. My top priority is to keep the short, medium, and long-term fiscal health that allows this county to do things that very few other counties get to do because we have a different way of making difficult fiscal decisions. That's my priority. And so, you know, the offsets to me are a symbol of shared sacrifice that every business, every renter, every worker, every person in our communities are going through right now. And, you know, so that's going to be a very difficult thing for me to get my head around as we move forward if there is not some understanding of what's that shared sacrifice. And it's not because I want, you know, I want to have that happen. It's just how, as 1 out of 5, that's what I'm looking for. We have everyone in our communities making unbelievable sacrifices right now. I want to know what sacrifices that are realistic beyond finding new money or not giving raises for 10 years might look like. So that's where this is not going to be the end of the conversation. Sure appreciate the amazing work that's going on here. I know what side of the reasonable risk curve I want to be on. And, you know, we all have a different place on that curve, but, you know, mine's going to be fairly conservative in this time. So thanks, Madam Chair, and thanks to all the staff who put this together, and happy to follow up with conversations if you have questions. Hey, there's a FedEx truck afterwards.
Thank you, Supervisor Babbitt. I do want to, I will go next, and then we can kind of bring this to a close, and then going forward for May 12th and 13th on the budget. And I thought I would just start out first. As you know, yesterday we had an all teams town hall. So all of the county, we encouraged every team member of the county, to join us for that call. And we had a great showing of our entire organization. It was an all team meeting of the entire organization, and just wanted to share with you some of the questions that came up regarding to budget. I thought it'd be very helpful. So I'm going to read those to you. Fiscally, with the loss of tax dollars, what does this mean for the county in terms of hiring for vacant positions, and how operations will be modified in the upcoming fiscal year? What is the estimated loss to the county as a result of COVID-19? How much does the county have in the rainy day fund overall? Taking all the financial uncertainty into consideration, is the county looking at the possibility of layoffs, furloughs, or pay cuts? Do you see an opportunity to save money by less leased working offices with the success of remote work? With the increase in health insurance, will the county consider covering that expense for employees? Are insurance premiums going up again this year? What impact will any budget issues have on programs that are fully grant funded? Is the board anticipating an increase in funding for public health activities? What is the impact of furloughs, layoffs on fee-for-service or grant-funded programs? Will these decisions be made separately from general fund positions? So I wanted to go over those because I did commit to the employees that were on the actual meeting that these would be written out and given to each of you, and then also anybody that didn't get their questions answered, and we were able to go through all of the questions. I think maybe there was one that we weren't able to go through, that they would get an answer from us in writing. And so I wanted to bring that forward to you. So my impression is this, and this is the lens that I'm going in with when we next meet on May 12th and 13th, that this is a responsible budget recommendation. I understand that we will have the need to continue to assess our revenues, and we will definitely need to be strong and very assertive, if not aggressive, in advocating for federal and state dollars. You know, we do have a HERF 10-year plan, so I do understand that this is specific to the general fund, this recommendation, and I do believe that it is a responsible recommendation. I know we've all talked about the unknowns, and certainly I understand the unknowns as well. But I do feel like it is responsible to use our revenue smoothing as planned. Even with the use of revenue smoothing, we still have another $7 million in reserves. So, I mean, one of the employees mentioned about the rainy day fund. We know about the rainy day fund at the state, and people ask, you know, what is the use of the rainy day fund, or setting aside that, or planning for a recession, or having emergency, having a fund to be used for emergencies or for revenue smoothing if you're not going to use it. So I do feel like we have been responsible in setting that aside. I do feel that this is the time to use that. In terms of raises, I would agree that it's not realistic to put a time period of 8 years of not having raises. I don't think that that does well in terms of attracting or maintaining employees, and so I would like to take a look at that. And certainly that can be a trigger as we continue to assess the budget. We can certainly look at that being a trigger and building in, you know, certain trigger points to address increases. For me, you know, my top priority is services to our residents, to the public, and we can't deliver those services without people. So in terms of, I understand that, you know, layoffs and furloughs are not off the table, but to me, a guiding principle is to make sure that we're managing impacts to service and to the residents that we serve. And that does take staff, it takes people to be able to do that. I also feel very strongly that we as a local government, as a county government, need to help stabilize our economy. We already have people within the county who have spouses or significant others that are being furloughed or laid off. And I want to make sure that we are stabilizing our workforce so that we can have people within our community that are working, and that we can continue to have you know, economic growth. And so for me, we're going to pay one way or the other. If we don't have people that are working, whether that be our residents and ensuring that there are programs for them to be put to work by advocating for state and federal dollars, or our own employees that can continue to work, we're going to see that back in our economy. We're either going to see that through a reduction of spending and tax dollars that people are not going to be able to spend, and so we're going to see a decrease in that, or we're going to see it through our community services and our emergency services, where we have more and more people who are going to need to access those, or we're going to continue to see it through unemployment figures and people seeking unemployment, which then again does not recharge our economy. So that is the lens that I'm going to be coming into May 12th and May 13th, and just wanted to share that. So thanks. And any further discussion about this? I think we've had a round where every board member was able to speak to this, and certainly this is not, as we mentioned, the end of the discussion. We have May 12th and May 13th, but is there any other board member that would like to express something else? Okay, super. Jimmy, did you get what you needed to be able to go into preparations for May 12th and 13th?
Absolutely, Madam Chair. And I just want to say a genuine thank you to you and to the board for the space to have this conversation, for your perspective, for your feedback. And we will look forward to coming back again on the 12th at 9 a.m. To spend 3 hours with you, and then again on the 13th to further pull this apart and make sure we are prepared going into June 2nd. But just thank you for your perspective. I look forward to continuing conversations over the next week going into Tuesday. And the budget team will take all of this into consideration during our conversation tomorrow.
Very well. Well, thank you so much. I appreciate that. And I appreciate all of the participants that are on this meeting. We have 71 participants. So absolutely appreciate you making this a priority to join us for this discussion. As I mentioned yesterday, we don't want to do this in isolation. So if you have any comments or feedback, for those of you who are participating right now at this meeting, please feel free to provide us your input. You can email us, the board directly. You can speak to Jimmy or any of the deputy county managers. I mean, feel free to provide us input. And again, there'll be opportunities as well, May 12th and May 13th.
And Madam Chair, if I could just follow that up briefly. So
Sure.
Along those lines, a reminder that, our normal elected official leadership team call both tomorrow and Friday. We will be having further conversation about reentry and the budget, and that an opportunity for our departments to also directly offer their input in those two conversations as well.
Great, thank you very much. So just to review our agenda, our goal is to go into executive session at 4 o'clock. And so I do want to see if we can reorder our agenda just to be able to allow us to go into executive session. I think probably all of us need a quick break to be able to refresh our water or excuse ourselves to the restroom. And so why don't we do that and reconvene at 4:10 in executive session? And so if that would be okay with everyone, and then after the executive session, we can look to doing some roundtable. Is that fine with everyone?
Sounds good.
Okay, super.
Chair Archuleta?
Yes, uh-huh.
This is Rose. I just wanted to ask to see if you could call for the vote into exec session now, since we have to go on to a separate Zoom call for the exec session.
Oh, sure.
Great.
Thank you for that reminder. Okay, members of the board, is there a motion to go into executive session?
So moved. Matt Ryan.
Second, Supervisor Fowler.
Thank you. There's a motion and a second for board to convene an executive session. All in favor of the motion, please say aye.
Aye.
Aye. Any
Aye.
opposed, please say nay. Hearing no one opposed, we are going to go into executive session, and we will start that executive session at 4:10. Thank you.
The Board of Supervisors will resume shortly.
I've been promoted to a panelist.
Yes, you have, Supervisor.
I'm going to put that on my resume.
Hi, I apologize. It took me a minute to get back in. Okay. Can everybody hear now?
Yep.
Okay, great. Looks like we have everybody. Okay, so we are back at our Board of Supervisors meeting. We just came out of executive session, and now we're going on to back to, we had our COVID update, and we had an item that we were considering that we moved to later this afternoon, which was the possible issuance of a proclamation restricting the use of certain public establishments. And then we're going to, after that, we're going to go on to our round table. And so, Eric, I think you have a draft of either a statement or is it an updated proclamation? Can you tell me what you have that you want to share with the board?
Certainly, Supervisor. I was asked to create, try to get the camera so you can see me. I was asked to create, so I have a revised proclamation. If you wish to look at that, I have also a draft statement of the board, independent of any action on that issue. If you wish to look at that, just a statement of policy, or not a statement of policy, a statement to the public about the orders issued by the governor. And then also there is a release that would accompany it if you do pass a proclamation. So I have those three items depending on which direction the board would like to go, and I can share whichever one you wish. So.
Okay. Well, I'm particularly interested in the statement. So would members of the board like to, would members of the board like to listen to a statement that Eric has drafted for consideration?
Madam Chair?
Yes.
So, I mean, I'm happy to listen. It's just obviously tough not to have any of these documents in front of us. I've got about 37 minutes left, but so I'm happy to read, but I will tell you, I'm uncomfortable contemplating actions without documents to see. So, but I'm happy to hear it. I just want to put that out early to you.
Sure, absolutely.
Ditto.
Okay.
So, Madam Chair, this is the statement. I'm sharing it on the screen. Essentially, independent of any action. So this is just simply the county takes no action on the proclamation, that you issue a statement disappointed about the preemption of local control and many of the same things we have talked about the differences of Coconino County versus the one size fits all. So if you wish me to read it, I can, or you can see it on the screen. I will. Tell me which you prefer.
Why don't you go ahead and read it?
Thank you. So the Coconino County Board of Supervisors issued the following statement in relation to the public health management of the COVID-19 response in Coconino County. Quote, public health and safety are a priority for our county, and we wish to be permitted to handle reopening locally. One size does not fit all in Arizona. Coconino County has various areas of concern, including hotspots and an alarming number of positive cases. Coconino County has not seen a 14-day decline in positive COVID-19 cases, a benchmark used to initiate reopening planning. The results of the first day of the Arizona testing blitz are also not yet known. Unfortunately, despite those facts and the public health trends locally, the governor has chosen to reopen businesses and areas where people can congregate in Coconino County. We know that the economic struggle is real for business owners and workers. The impacts of the COVID-19 pandemic affect the county as well. However, reopening and relaxing the public health measures that mitigate the spread of COVID-19 could lead to a potentially disastrous second wave or surge of positive cases and deaths in our region. We must follow the governor's executive orders, but we remain greatly concerned that it is too early and too soon to know if it is safe for business to reopen in our county. We encourage all businesses to follow CDC guidance, including staying home as much as possible, using caution and wearing masks while in public spaces where it is difficult to practice social distancing, and regularly washing hands. I apologize for the couple errors there. Business owners are encouraged to follow guidance on frequent sanitizing and disinfecting of surfaces when taking steps to reopen. So there's a couple little spots to clean up, but that's the gist of it.
Sure. Okay. Well, I appreciate that. And obviously, if the board wishes, this statement can go out. And if you all need some more time to consider it, then, Eric can rework it and bring it back to us. So what is the board's pleasure?
So I'll
And
go
then
ahead.
there's also, as he said, he has a modified or revised proclamation as well, which if you wanted that, I understand that would need more discussion, and he could send that out as well. So go ahead, Matt.
Thank you, Madam Chair. So yeah, this one, a little bit of a conundrum in that I think the statement is actually capturing where I would end up at this point. As much as we're looking at a trend that has not reduced, there are actions that are being taken that aren't considering that we have a surge in this area. And I think no matter what we do, we need to attempt to reach out to the governor's office and to the ADHS to ask for their plans and potential implementation of surge protocol. And that could help establish using the CDC guidelines as potential measures of how to implement and what should be done. This area probably should be considered that way, but currently the way that the executive order is written, it makes it a little bit more difficult. Even if we did step forward, we could be challenged. And if we were moving forward as a region, perhaps I would join a coalition, but to only do this in the unincorporated areas with inconsistency with the incorporated areas, I struggle with that one. So I'm more apt to go with this statement. However, within the next week, we don't have to do it overnight, but the piece that's missing by not doing a proclamation is creating until further notice related to our own order. And I would think our own order needs to align a little bit more with the governor's order. And if there's an area that we need to do further investigation and consider the data provided by our local health department, our local epidemiologists, and the studies that validate that we really do have numbers that have not started to curb, then we have that potential to consider in the future. But I'm not prepared to go beyond that. But I'm curious to see where the board wants to go here.
Great. Okay. Thank you very much. So, I think this statement is a good start. I do think it needs a little bit of massaging. I mean, and that's the reason for bringing it forth. And again, we may just want to bring this back, but if we do agree to bring this back, I mean, I would say, for example, the urging of the governor to take into consideration the facts that are cited there, the lack of a 14-day decline, the fact that there's hotspots, some clustering. I would say that, it'd be like more of a one size does not. Well, we did say one size does not fit all. So I think I would say like Coconino County urges the governor, urges the governor to take into consideration, X, Y, and Z. So I mean, I do feel like I'm trying to balance between, I do feel like it's important that the public hear from us and that we don't lose sight that we are not seeing decline in numbers. And so that just trying to reassure the public that we know this, and so that we are urging that their behavior remains vigilant, and that we are urging the governor to look at all of the data and to look at it situationally according to each county, because it's not one size fits all. And so I would say that just this can be reworked, and then get it back to the board. Others?
I have a couple comments. Yeah, so I really think we should consider how this faces. We are, I do not believe it is a proclamation which tries to move us into opposition of what the clear defined trajectory of the governor's authority of executive and his executive powers is a smart move from a strategic or a practical point of view. I would be open to a statement. I would be open to a statement that was a balanced statement that showed, yes, we haven't had an increase in here, Flagstaff in last couple days. Reservation is clearly dropping. Overall aggregate numbers have not downward trajectory for 14 days. Deaths most certainly have downward trajectory. So let's include that. Let's include the part of the success that has occurred where our critical care capacity that we referenced today has been very strong. The hospital being at only 50% capacity, critical care, despite what some numbers come to us as, has been very, very strong. And so, those were one of the criteria. So, I am not comfortable with this as it's written. I think we should paint a picture that recognizes what has been going on, who has been sacrificing. We need to recognize that sacrifice in a way that points us forward about protecting vulnerable populations and the forward-thinking, visioning of how we make, whether we like the timing or not, whether we thought May 15th was the right day or not, that's not the reality. Let's keep facing this forward to try and get, a positive flowing document that recognizes the challenge of losing local control, but also our responsibility. And the last thing I just want to say is, when on our break, I happened to take a walk, clear my head around the neighborhood, ran into a physician and asked him about, hey, what do you think? And it was really interesting because many people believe a fall surge in October is a good probability, and this is just one person's perspective. But I think I happen to share it, is that those of us who are low risk should be getting reasonably out. Those who are high risk should probably not be getting out. Let's talk about that in this document. So I'm comfortable with a statement. I am uncomfortable with a proclamation, but it needs, I would love to have it, the right tone and right supporting where we can go together and supporting the actions and behaviors and individual personal responsibility that is going to be required if this opening of the door is to, not have really bad repercussions. Thanks.
Great, thank you, Art. Let's see, Lena? And if there's, I think we're pretty much, providing direction here. I think the staff is getting it. I think what I'm sensing, and from myself too, to revise it, I think talk about positive things, soften it a bit. Is there any other feedback? Supervisor Parks, Supervisor Ryan, Supervisor Vice Chair Feller. Go ahead, Matt.
Yeah, I mentioned it, but I don't want it to get missed. We really need to speak to asking the governor to come up with protocol for when a surge does come back. I don't disagree with what Art talked about and just what you noted along that line. That's one piece that I would want us to make sure that we have incorporated in there.
Yeah, do you all also agree to speak about, local control? This is, like checking in with us, promoting local control. To me, that's what this is about.
Should be one of the beginning of our conversations, but we have an emergency. They're trying to get consistency. But yeah, I don't have an objection.
Okay, others?
I think that's a good start, Madam Chair, the statement. And I think we should still caution people, talk about the positive, but at the same time, though, caution people that are vulnerable to really take care of themselves, and that they may want to stay home for a while some doors open up, and then people are starting to go out. But I think we still have to have that warning in there. I agree that we should really make a statement to the governor saying, and he knows that we're not where his numbers are. He knows that. So and he just met with the nation again. So I think that's something that is very much. And I'm just wondering if we want to mention that Navajo Nation is part of our county in the statement. So thank you.
Okay, yes, certainly we can do that. Supervisor Parks, and then I know we need to move on.
Thank you, Madam Chair. Well, I do see some problems with the letter, and I think that probably all of you are correct that it needs to be toned down. But I think it needs to go to the governor first. That's where I think it needs to start. If that's that we're going to do. I of course am pretty skeptical about the resolution. I really don't think that we need to A, go against the governor, or B, go against our business. However, most of the restaurants and businesses that would be affected by this are not in the county. They're in the city. And so, anyway, I see a lot of problems with the resolution itself, and probably am not going to be supportive of it at all. I think that we need to try to collaborate with the governor on this, and I think that Southern Arizona and Northern Arizona are two different parts of the world, basically. But we have a problem up here with Navajo Nation and the great amount of hardship that this COVID-19 has caused to the Navajo people. At the same time, I can see that we need to open up business. And this is ultimately going to come down to individual people, both individual an individual's use of the face masks and hand sanitizers and social distancing. That's going to have to be primarily an individual choice. And that isn't going to be just for now. That's going to be for a long time. However, I feel that medically speaking, that a person's own immune system is going to have to be the thing that is eventually counted on here, because we're all going to be eventually exposed to this virus, all of us. And however our system operates in order to produce the antibodies to throw this virus off, that's going to ultimately be where we wind up as survivors. And I think that I heard people mention that it was Art, I believe, and Lena, that mentioned that with folks that are of the more high risk group, and they feel that they should stay home, they should stay home. I'm of the high risk group. I'm 70 years old. I reached a point quite a while back that my immune system's going to have to take care of me. I put a mask on when I go places, but that's to protect other people, not necessarily to protect me. I don't feel that my views should be pushed on someone else. I don't believe that my lack of a mask should be pushed on someone else. So I try to use the mask when I'm out in public, especially if I happen to be in Navajo Nation, because they are required up there to wear masks. That's part of the president's mitigation plans. Everybody's supposed to wear a mask and stay at home and observe the curfews, and so I do that. But it's going to boil down to eventually to the individual, both to their own individual system of antibody protection against the virus, and it's also going to end up being their own discipline for others. So I do still have a problem with the proclamation and the letter. It needs to be toned down, because we don't need to take this letter as it is and put it out there into the public, publish it in the newspaper, and not have the governor given a chance to see it, or if we tone it down and make it more palatable to the governor and to the state officials. I still believe the governor needs to see the letter first.
Okay.
That's about it. Thanks.
Thank you. All right, so I think we have the direction that we need, and we can move forth to our next item. This is a discussion and possible direction regarding state or federal legislation. Eric, anything on this? And I know we're going to move quickly here.
Yes, we will move quickly. I just wanted to update you. I provided the board updates on things that are happening on the federal side. Obviously, the House is moving forward. We've seen a directional change in federal funding. So in the past, we've been grouped together with the states. The House is talking about it creating a local government fund separate from the state, so we can be out of competition with our fellow local and state governments and such. So that letter has been forwarded to you. It's information. We'll continue to advocate on that. Bob and Anna have it as well. Also want to just give you a heads up that, and I sent this out, some revised guidance on the CARES Act has been put out. To answer a question from earlier today, physical properties are allowed, real property is allowed. So I just want to highlight that for you all, that we could use it for a capital infrastructure project that is related to COVID-19, a medical or mitigation structure. So that information is out. As to the state legislature, it is still as clear as mud with what will happen at the state legislature. They obviously did not return last week. They have not scheduled anytime this week. There is a majority when you look across the whole both houses to adjourn sine die and come back for session at a later time. There's not a majority within the majority to do that. And so that is the consternation. Senate President Fan did warn those today that were around and her members that there are not as many COVID-19 essential bills that have to be done as legislative members are saying are essential and must pass. So I think there's a real push by some, including, we heard the county attorneys want to try to pass some bills yet. That is up in the air on what the leadership will allow to hit the floor should they come back and at what time. So that is that update. Of course, I'll just add, there are lots of folks on the state side that are mostly from the majority party that are considering resolutions that, if passed by the legislature, would actually rescind the declaration of emergency on the state level to take away the governor's executive power to close and issue the orders he has issued. So there is a, just call it the libertarian streak, is growing in terms of those publicly reporting that they want to see the majority parties move in that direction. So that's my update in that regard. And if there's any questions on federal or legislative issues, I'm happy to answer them for you.
Any questions for Eric? Okay, then let's proceed. Jimmy, anything for the board that you want to share?
Thank you, Madam Chair. Just a quick reminder, we will have some further budget discussions on Tuesday, May 12th from 9 to noon. We do have a board meeting that evening at 6 o'clock. We have agenda review at 10 o'clock tomorrow to plan for that. And then May 13th, again, 9 to noon, with the option of coming back in the afternoon. Just also a quick reminder that EOLT calls Wednesday and Friday this week will include further discussions on reentry in the organization, including comments from supervisors like Babbitt that talked about our lease space, and we're going to pull that apart some more. And we'll also be talking with departments and getting their feedback on FY21 budget discussions. Thank you.
Thank you. Did you want to talk a little bit about the town hall tomorrow?
Yes, thank you. So the town hall tomorrow evening. I do not have the agenda in front of me. Eric, do you want to mention that? I know the team has done an amazing job of especially pushing this out on social media. So Eric, can you fill in the blanks briefly on the public town hall scheduled tomorrow evening?
Yes, sir, I can. I'm sorry, I was trying to find it. I just don't have it on the computer we're on, so I apologize. I'll just pull it up quickly here and to just go through. We do have that on for 6:30 tomorrow night on Zoom, like we are right now, and then also on NAU TV and streaming on the Coconino YouTube page. We did, and I want to be very clear with this, Supervisor Archuleta had sort of given us a brief rundown, and Supervisor, I just want to address this, make sure everyone's known a couple things. We have each supervisor slated for a 2-minute welcome introduction piece near the beginning. But by the time we add in then the talk, I don't want to call them talking heads, but essentially the presentations, sort of laying the context, we don't want to get too late. So we're really going to ask supervisors to hold it to about 2 minutes and just offer your comments briefly, and we'll go in order there. So Supervisor Archuleta will start, and then your following colleagues and Supervisor Archuleta would call on you. I'll be there to help moderate and click buttons and get everyone locked in. So.
Yes, and you're being really nice. We're going to keep it to 2 minutes, and then that's it. And there is a mute function. So we're going to mute you.
I can strike up the orchestra.
If you're 2 minutes, 10 seconds, we're going to mute you.
Filibuster.
That's right. No, but seriously, we needed, because the whole purpose of this, right, is to get to as many questions as possible. And so people, like, they want to ask their questions and hear us answer their questions, not necessarily, hear just all of us say the same thing. So yeah, to the extent that you all can be unique in the comments, that would be great. And so if you already hear somebody address something in their introduction, yeah, try to change course if you can and address something different in your comments.
So just on that, then there's a couple more technical things I just want to address for everyone. We will have ASL interpretation, so there'll be another panelist like you see on your screen now that will be there providing American Sign Language. We also will have, hope to have captioning turned on, but then also there will be Spanish translation. So Zoom allows that. So we will have translators listening to what you say, and then those that want that, the other language, can just click the button and they'll get a different audio channel and hear the translator that goes along with. What I want to bring up though is—
I thought you're reading my mind. I just sent that. I just literally pressed send on an email to you.
Yep, we've got that. Was accomplished. So that is a great news. It'll be on NAU TV. You don't have to do anything special because it's TV. But what I am asking all of you, you do not have to have your camera on when you're not speaking. But we do need that. Remember, this is going on TV in a wider audience. We should treat this just like we're at a town hall where you're on the dais. And so please, when you're giving your introduction, answering questions, turn your camera on. Otherwise, what the attendee will see is just your name and hear your voice. So find your spot where you're going to be. If you want to come to the office and sit in your office, if that's the right look for you, find that spot. I will be in the Grand Canyon room here to help to make sure I have a good hardwired connection like I am now. But I do want to ask you to make sure your camera's on when talking so that we can see, the people can see you. So.
Yeah, or you can change your background. I mean, I don't know. I tried to on Zoom to change my background. I could do it on Teams, but there is a way, usually on Zoom, that you can, even if you're sitting at your house and you're on a couch, you can change your virtual background and you can show like an office setting. There's a number of different settings you can choose from. You can also like blur your background so that if you don't, like if you change your background, then people won't even see where you're at. And if you blur your background, then everything in your background will just be blurry. But you'll have to do that ahead of time and kind of fiddle with it to make sure, because it takes a particular updated computer to be able to do that, or laptop to be able to do that.
I will just point it out for you, Madam Chairwoman. This is a little different view, but I've done mine. You can see sort of the county logo behind me.
Yes.
But if you just go to stop up where the video, or down on the bottom, wherever your video thing is on your screen, this just choose virtual background, and then you can upload any image you want. You can have a picture of your family, a picture of a horse, a picture of the mountain, whatever you wish. So you can add any image you want in there, and that's how you do it.
Right. So try to work on that for tomorrow if you plan to be somewhere where you feel like you're going to be interrupted, or there's going to be people passing by, or you're going to be on your comfy couch or your comfy bed, then you probably want to switch out your background.
And the other thing is, Supervisor, we will have we'll have folks listening to answer questions. We can always pull down the report of questions that are asked after the meeting, so we'll make sure to have all that up and online following that. But again, we're really looking forward to a good town hall tomorrow night.
Any questions of Eric about the town hall?
I did it.
Was the agenda emailed out already?
Town hall, ma'am?
The agenda, Lena's asking about the agenda. Was it emailed out?
Not to the rest. We'll have that out here shortly to the rest of the board.
Okay, we'll have it out. We'll have it out this evening.
Yes.
Okay.
The agenda is posted. It is a special session of the board, so the clerk will be taking minutes.
But the actual like run of show is going to go out here very soon. Right?
Yes.
Okay, super. All right, round table. How's everybody doing? How about we just stick to if there's something like super important? Is that okay? Since it's 5 minutes to 6. So does anybody have, we won't go, we'll just kind of move around. If you have something that's super important, then report it. If not, you're welcome to say pass. Okay, so Supervisor Babbitt?
Pass.
Excellent. Supervisor Ryan?
Only that the transportation discussion with the business community happened today, and we'll get further updates, and we have a couple like metro plans tomorrow, so we have more transportation discussions to have, and it revolves around the CARES Act and what happens associated with that.
Excellent. Supervisor Parks? Probably just want to unmute. This is just if you have anything you'd like to report out that's super like urgent, or you can pass.
I just want to say thank you to all of you and pass.
Okay, thank you. Supervisor Fowler?
Thank you to all, and I don't have anything to report. Thank you.
Okay, great. And District 2 and the chair will pass because anything that I've had to share, we've already talked about it today, and you've heard from me probably over the weekend or in the past couple of days. So thank you very much. Oh, wait a minute, I will. So the town hall, well, the internal town hall that we had, that document with every single question is going to be sent to you. We had some great questions so that you'll know what the questions were and who asked the questions. And then we do have that's all recorded. If you'd like to see the meeting in its entirety, also that is available. Okay, but I can tell you that the county team, all of the employees really appreciated the fact that they had a forum to be able to ask some questions. All right. That's
And I'll have a follow-up in my global on Thursday as well, Madam Chair.
great. Okay. That's wonderful. Well, thank you all. Appreciate your time today. And apologize that it went over, but thank you. I think it was good discussion and appreciate it very much. Thanks for all the work. Okay, we're signing off. We're adjourned.
Yay. Thanks,
Bye-bye.
Liz. Bye,
Thank you.
everybody.
Bye-bye. Oh, I love your background.